Those of you who are English speakers, please make sure that you click the English channel on the globe down below. We need all English speakers to do that so the interpretation system works correctly. And for those of you that are joining us in Spanish, please check the button in Spanish. I want to start off by thanking Diana Staden for the incredible work that she does over the last 4 months, putting together all this data and information and one-pagers and chasing people down for their information and making sure that we have what we need for today. The cool thing about technology is even if you turn something in late or something develops between now and the session, you can still send that to Diana and she'll get it posted on our website. Right now, all the material for today can be found at the Arc of Washington website at arcwa.org under the legislative notebook. So if you have any trouble tracking the issues, you want to see something later, all the information is found there. Just a moment as people are joining, I want to make a tribal acknowledgement and that we acknowledge that all of us are residing on the homelands of the Native peoples who have lived in this region from time immemorial. And in Washington state, we have 42 tribes that share traditional homelands and waterways. Some of these nations are confederacies that represent multiple tribes. And today we want to honor tribal sovereignty and self-determination and thank them for their contributions to Washingtonians' state and local history, culture, economy, and identity. We express the deepest respect and gratitude toward these original and current caretakers of the region, and we strive to include their voices in work every day. If you know what tribal lands you may be on today, I encourage you to put it in the chat. And if you don't know what lands you're on, we have a cool map that we're happy to put in the chat in just a couple of minutes and you can take a look. So with that, I think I want to make sure again, one more time, just a reminder for everybody, make sure you click the globe down below so that you're on the English channel or the Spanish channel. Today, because we are using interpreters, we're all going to try really hard to speak more slowly, myself included. I'm one of the worst. So you may occasionally hear an interruption just to remind people to slow down just a bit. And thanks everybody for putting their tribal lands in the chat. I'll take a moment and just introduce Brandy Mons. Brandy, you want to say hello to everybody?
Good morning, everyone. Brandy Mons with the Developmental Disability Council. Welcome. Happy Monday. If you had a chance to check out that notebook that Diana put together, there is some really great work happening and we are so excited for session. We're going to get started in just a moment. And again, thank you to Diana for all of the great work to pull this event off.
And some people are putting in their county, some in their tribal lands. We always like to know where people are from. So you can keep that up.
And in the meantime, if people want to follow along on their own computers, everything we're going over today is on our website at the Arc of Washington, arcwa.org. And if you go to advocacy, you'll see the legislative notebook, and you're going to choose the 2023 legislative notebook. So this is what we're working from today. And right at the beginning, it has the agenda for the meeting that you can click on to follow along. So I think we'll get started. We've got a lot to go over today. And we're going to start with our one-pagers. We have tried to accumulate information on each issue that we believe is going to be coming forward for the legislature to look at. And so we want you to be able to have one page of information that you can familiarize yourself with the issue on, and also that you can share with legislators so they just can look at it one page and have a good understanding of what the issue is. And our top issue this year is caseload forecasting. We still have over 12,000 people sitting on the waiting list on the no paid services caseload. We had people sitting in the residential habilitation centers or RHC. Those are our state institutions for people with IDD, intellectual and developmental disabilities. And we also have people sitting in hospitals that are waiting to get out of there and get into the community. And all these could be helped if we had true caseload forecasting for DDA services. So I'm going to open up this first link here. And this goes over the caseload forecasting need. Stacy, do you want to say a little bit about this?
I do, but Diane, I noticed that Representative Taylor is joining us here, and I think she was going to do a little intro. And so I'm wondering
Yes,
if
let me find, sorry, I didn't see her come in.
I'm here, I'm here, I'm here, I'm here.
I know, I'm looking for your name to.
It's under Rep Jamila Taylor.
Oh, okay. Thank you.
Those titles. Good morning, everyone. Thank you so much for gathering today. I wish I could be here for the entire presentation, the whole event. But what I want to tell you is that I am working with my colleagues as we are prioritizing IDD as part of our legislative actions out of the House. And I have many colleagues who are very much interested in this work and this effort. I want to tell you one thing is that when we received our briefing on Friday about the DDA and their caseload forecasting, the courtesy caseload forecasting, I'm still reacting. So I'll just save my comments on that for a little bit later. But at the end of the day, the needs are high, and we are working diligently to come up with comprehensive solutions to get us out of the marginalization and leaving our community so far behind. Let me go back. I'm Representative Jamila Taylor out of the 30th District, and I come to this work as a twin sister of a man who has developmental disabilities and many abilities that are unseen, unheard, and unappreciated by community. And so I want to tell you how committed I am to ensuring that my community, our community, is heard by the legislature and prioritized as we have essential needs that have been left behind for so very long. I have convened in the past the Developmental Disability Caucus, which was in both chambers, both the House and Senate, and included Republicans and Democrats. And so this is important as we are looking to get the right solutions for our community. There's a lot of work that spans many committees, and in particular, the work that we're doing on developmental disability policy in the House is shifting from the Housing, Human Services, and Veterans Committee, where it sits right now, over to the Human Services and Early Learning Committee. I am hoping, as we are reforming our committees, to go with that work over into that committee. And I share all this information because there are new players that this whole body will be wanting to engage with, and committees that they will want to attend as we are presenting our proposed bills. Priority number one, housing. As part of, the caseload forecasting is absolutely, necessary for us to work on. But as the caucus in general is looking at housing, we have to have specific carve-outs for the developmental disability community when we're not looking at comparing housing needs that are apples to apples. And then we also are seeing that there's special education concerns that have hit the newspapers on a regular basis. And I'm getting copies of articles over and over on what are we doing about this? We're going to do something. What it will be in partnership with you. We'll be in partnership with lawmakers and partners with those who are charged with implementing the policy and making sure that our intent as a legislature is not undermined by those who feel like they don't have the resources. It's our job to make them sure that the resources are there. It's their job to make sure you have the resources in your hands. So I am going to keep it brief. And if anyone has any questions, please, please, please reach out. There's many more things that we're going to be working on as part of this coalition. So anything I haven't said doesn't mean it's not a priority. It is just not top of mind and in this moment, because I'm just excited to be here. I feel like, if you've heard me say this before, I'm on the hero support team. You all are the heroes of the community, and I am here to support the efforts you are making towards our members, our residents, and ensuring that we have what we need to thrive everywhere in all corners of our state.
Well, thank you, Representative Taylor. And speaking of heroes, you were our hero from last session, and we can't thank you enough for the work that you did around eligibility and IQ scoring and dual services for our community, among many, many other things that are impacting us all today, including many people who were able to get services because there were additional waivers provided. So we're super excited to work with you again on caseload forecasting and housing. If you cannot stay today, we're recording this, so we'll be sure to highlight anything for you, because I know you don't have time to watch that either, but we'll make sure and get you the highlights.
Yes.
Thank you again so much.
Thank you. Thank you so much.
All right, Diana, pick up where we left off.
Well, I'm going to let you say a little bit, caseload forecasting is such a huge issue for us, because so many of the other things that we need depend upon the caseload forecasting. And so I'm going to let you, did you have something you wanted to add to what I had said?
Me? Yeah, I want to make sure that people understand as we go into this legislative session that there is some very significant confusion right now over the caseload forecast that came out by the Caseload Forecast Council. I think we anticipated that there would be some confusion, and unfortunately it did come to fruition. That forecast was focused on the request list that sits within DDA. And because DDA has been working diligently contacting people on the no paid services caseload, and they were provided additional waivers, the request list over this last summer basically went down to 0. From what I can tell, the same week that the Caseload Forecast Council called and said, how many people are on your request list so that we can provide information to the legislature about future need? And so it would appear that DDA has sufficient services and nobody is in need of a waiver at this point, which is certainly not the message that should go to the legislature. So we are working hard with DDA, the caseload forecast, with Representative Taylor, to really understand what is the request list, how do you get on it? Anyone here who currently needs a service and has not informed their case manager that they would like to be on the request list, we certainly invite you to do that because the request list has become such a notable list now that people are paying attention to. You need to ask your case manager if you're on the request list or not, because there's not a way to notify you of that. And send an email to document that. And I would encourage everybody to do that that is currently waiting for services, so that that is really clear. In the meantime, we're going to look at a different way to make sure that people indicate the services that they need. And if they're not currently getting them, that DDA understands who you are and how many of you there are, so that we can talk to the legislature about increasing services. And I just saw from the interpreter that I'm speaking a little too quickly, so I'm going to slow down.
Okay, and I'm going to cut you off there a little bit, Stacy. We are going to go over some more of this about caseload forecasting when we get into the charts section.
Perfect.
And so we're going to have a little change in our agenda. Excuse me. one of our guests, Tanya May, is here from OSPI, and she's going to need to leave early, so we're going to give her a minute to talk about some pages that she has in here. So if you go down to where it says Transition Collaborative, that's the page I'm opening up now. And Tanya, are you here?
I am. I'm hopeful that you can hear me.
Yes.
Earlier we had some audio issues.
Yep.
Oh,
We can
good.
hear you just fine.
Well, great. Thanks, Diana, and thank you, Stacy, and all of the group for inviting me to join you today. There is more that we can be doing around the Transition Collaborative, and as a partnership, I'm really excited that I have the opportunity now to welcome some of the newest members to our Transition Collaborative, Brandy Montz and Melinda Bacci, who is kind of helping to really support the Division of Vocational Rehabilitation with expanding school to work support statewide. We're in the process of really gathering input from our community members around the vision for a statewide transition council. So that work will continue. And I know that I don't have a lot of time on the agenda because you have many guests with you today. So Diana, I'm hoping that I can go off script just a little bit and talk about some of the other OSPI priorities that we have around special education. So I'm going to put them in the chat so that you have them visually as well. There are 3 things that I wanted to make sure I touched on today. And I'm going to try to go slowly enough for our interpreter as well. So
Okay,
the first...
do you want to pull up
go
your
ahead.
page? Do you want to go
I
ahead
can.
and pull up yours?
Sure, I can do that. That way everybody can see. Oh, but I need permission first.
I just gave it to you.
Okay, thanks. And I'm relieved that I actually have a document to share because when I was working on it, my Word failed and I didn't think I was going to get it back, but it recovered it. Okay, so the 3 topics I'm going to talk about is fully funding special education, re-envisioning our safety net priorities, and then while there are some details I can't really get into yet because they're in development, I wanted to address them and make sure that everybody was aware that there's more to come on that. So there are some additional actions that we're working on right now across our partnerships. So the fully fund request acknowledges that our school districts are spending over $400 million a year for special education than they're receiving. And that includes both our federal special ed funds and state special ed funds. And so that gap in spending is being covered by local funding sources like local levies. And so we are requesting that the state legislature remove the 13.5% cap on state special ed funding, increase the special education multipliers. That's the amount of money a district receives, additional funds a district gets for every student with an IEP in their system. And we're asking for them to consider that for preschool, as well as our tiered K-12 multiplier. We have 2 multipliers for K-12. And to continue funding to support the expansion and scale of inclusionary practices so that all students have an opportunity for meaningful inclusion in general education setting with their peers. And so I have a couple links that I'll try to copy here for you, and I'll pop them in the chat. And I'm being asked to speak more slowly, so I will. So the first link is the full funding request. It's pretty technical. It has a lot of formulas in it and fiscal information. And it can be a little bit hard to unpack. So what we also did was we created a briefing document, and that's the second link. And that one has a little bit more plain language. It has some definitions. toward the back about some of the terms that we're including in this. And I'm happy to, talk offline. If any of you have questions or want to learn a little bit more, you can reach out to me anytime. I'll put my email in the chat too. So that's our first update today. The other one, so one of the things I've learned in my time in special education is that all things are connected. And so, we're really asking our legislative partners to support us in re-envisioning the priorities of safety net. I believe that when this system was created, there were consequences. I don't know whether they were intentional or unintentional. That was before my time. But they limit access to certain services that support our students, families, and communities. So, for example, it is a simpler matter for a school district to get safety net reimbursement when they send a student to a non-public agency or an out-of-state residential program than it is for them to think about the professional development and capacity building that they need to do in their own district so that the student can be served in their neighborhood school. So whether or not that was the initial intent, I think we can agree that that's not our intent today. And so our ask is to open up that flexibility so that we can include transition plans, so that we can be building capacity in our local schools so that students can be served there. We also know that there are students who have very extensive support needs and sometimes do need to have a placement. And for our smaller school districts, that can be incredibly challenging. They don't have access to large budgets to afford the cost of some of these programs, even when they're desperately needed. And so one thing that we're exploring is whether school districts could receive quarterly reimbursements for safety net for these out-of-state programs, the specialized programs, rather than waiting a whole school year when the student has been placed in that facility for more than 1 year. And then the third change that we're asking for safety net is that if the 13.5% cap is removed, then we can remove community impact from safety net because it would no longer be necessary. Community impact is an option for districts to make a case for why their special education rate is over 13.5%. So I talked about the full funding request. I talked about this vision for safety net priorities. And then the two that are, there's several legislative actions that we're still considering. The two I wanted to talk to you about today is one, a bill to eliminate the use of isolation. So we're working on that, and there's a work group. Some of you may be either serving on that or familiar with that work group, and so we're working with them around those recommendations. And then we're also looking at expanding the data collection from and collaborative oversight of our non-public agencies, including those in Washington State.
Thank you, Tanya. Does anybody have questions that they would like to find out? I saw in the chat that there was someone asking what OSPI is, and that's the Office of Superintendent of Public Instruction. I think we get so used to these acronyms sometimes that they just come out and we forget it's an acronym that some might not know, but thank you,
Absolutely. Thanks, Diana.
Jake, I see, has his hand raised.
Yeah, just super quick question. Can you expand a little bit on that very last point? I'm not quite understanding exactly what that means.
The final bullet that I have on there?
Yes.
So we have been over the past several years really looking at our state's capacity to monitor and really look at the services that are provided with the non-public agencies. So currently, those non-public agencies, which are privately run schools that are where students with disabilities are placed by their school district and IEP team. And so public funding is used for that. And so currently kind of the mechanism for reporting data is those non-public agencies report the data directly to the school district that placed the student there, because those districts are still responsible for the free and appropriate public education of that student, right? Because they placed them somewhere doesn't mean that they no longer have a connection to that student. So the data gets reported to the school districts, and then those data get reported to the state, to OSPI. That can cause some challenges. And so there has been some discussions around whether certain data, so attendance, discipline, restraint and isolation, and graduation should be reported directly to the state for students who are being served there. So that's the data collection piece. And then this collaborative oversight. So, you know, school districts that place students there, they have a contract with these non-public agencies. And when there's a concern or an issue, they'll let OSPI know. And so OSPI can remove that approval of that non-public agency to provide services. And some of these programs, you know, they have multiple types of support. So they may be connected with mental health or some kind of hospital or therapeutic program. And then they also often are serving as private schools that are approved through our State Board of Education. So we want to work together kind of across all of these touch points that connect with the non-public agencies so that we can make sure students are safe and served and making progress.
Thank you.
Mm-hmm.
And then Justin, I see you have a question. Go right ahead.
Yes, this is Justin, and I was wondering if, like, you know, I think I'm glad to see that the bill to eliminate use of persuasion. Does that have to do with putting students like in, you know, classrooms for like all by with other people with IDD, and taking them out of that and putting other students with people that don't necessarily have any intellectual disabilities, just so that they can be connected with other peers. And yeah, that's my question. Is that what it means, or is that something else?
Thank you, Justin. That's a really important question. I'm glad you asked it. So isolation has a very specific definition, and it is when, so in terms of our rules, when there is imminent danger, right, or a student could be harming themselves or others, there are some options that school districts have to maintain safety. And so isolation is a practice where a student is put into a room alone. So that's that isolation piece, right? They are by themselves. And they're not permitted to leave that space. So in some cases, the door might be blocked. In others, there may be a lock on the door. And that's the practice that we are supporting to discontinue in Washington State.
Yeah, that's not right. I agree. We should stop doing that. I agree. That's just not right.
Thank you, Justin.
I like it.
Okay, well, Tanya, we're really appreciative that you took some time to come to this meeting today. I know you've got a busy schedule with lots of meetings, but I'm sure we'll be meeting with you and talking with you a lot during this session. So thank you for coming. Okay, so
absolutely, I appreciate all of you.
Go ahead.
No, just saying thank you. I appreciate it.
Well,
Thank you, Tanya.
Okay, so let's go back to our webpage. Again, for those who are following along, this is on our website at arcwa.org. Go to advocacy and hover on the legislative notebook to go to the 2023 legislative notebook. And there is also an agenda right at the top of the page there. And we've got started on the one pagers. These are the issue pages that you can learn from and share with legislators. And the second one has to do with wait lists. The legislature doesn't understand all the different types of waiting lists that DDA, the Developmental Disabilities Administration, has. DDA got sued years ago because, according to the Center for Medicare and Medicaid Services, which is CMS, they cannot take federal money unless they comply with certain rules that CMS has. And one of them is no wait list for the waivers. So instead of a waiting list, it is called the No Services Caseload. And about a quarter of all the DDA clients are on that. If those clients know that they need to get onto a request list, which is what DDA gives to the legislature, then they get put on a request list for the waiver that they need. But most of those people have no idea they're supposed to be requesting that. And that's because they haven't had case managers since 2011 when the legislature cut them. The legislature last year just gave them back case managers for the no paid services caseload. But it's going to take time for them to hire and train all these new case managers. So it's important that we let people know if they're on that no paid services caseload, contact a case manager or someone at DDA, or contact us. Let us know that you need a service and get on that request list, and we'll help you with that. Then there's the people that are living in the residential habilitation centers, which are called RHCs. Those are our state institutions for people with IDD. And we have 83 people sitting in those RHCs that have funding to move out into the community, and they've requested to get out in the community, but there is no community placement for them. So one of the problems with this is that if those people could get out of the RHC and into the community, the federal government pays 75% of the cost. Normally, we only get a 50% match from CMS, but this particular program has a 75% match. So the state has to pay less, the feds pay more of it. But 27 of those 83 people have been sitting for 2 years waiting to get out of the RHC. So that's another place that people are waiting. And Stacy's screen sharing. Stacy, are you there?
Yeah, I just put up the waitlist page because you just had the main page on.
Oh, so it's not shifting for me. Okay, I didn't realize that. Sorry. Then they have another group of clients. There's 84 children and adults who are stuck in hospitals with no medical need. And we don't have community placements for them either. That's why they're stuck there. And there are also babies and children who have really complex medical needs that are stuck in hospitals because it's cheaper to keep them in a hospital room than it is to send them home with all the services and supports they need. Plus, there's a nursing shortage, which is part of what those kids need. So they get stuck in the hospital. And when the legislature reports or asks for a report from DDA as to how many people are waiting for services, they get the numbers on the request list, which you heard about earlier from Stacy. So it's really important to get people on the no paid services caseload or any other caseload, even if they have paid services but not a waiver. We want to make sure everyone knows to get on those request lists. So Stacy, do you want to share the next page? That one is about housing, and Stacy is going to take it from there.
Let me see if I can pull that up real fast. And
Well, I can do it too.
yeah, sorry. There we go. I got it, and I just need to share it now. Diane, if you can do it, that'd be great.
Oh, okay.
Too many steps. Okay, so if many of you know, housing is one of the #1 priorities that we have, because it serves as a barrier for people being able to live in the community. Even people who have waivers right now, that allow them to put together resources for residential services to live in the community, they cannot, because we have a lack of housing that's appropriate to meet their needs. You all may know that every biennium, for a long time, for almost 10 years now, the legislature has given us about $3 to $5 million in the DD set aside for the Housing Trust Fund. That fund allows us to build a handful of houses across the state, which is not enough to keep up with the need over the increasing numbers of people who need to live outside their family home. In particular, if you just look at the needs of people with developmental disabilities whose caregiver is over the age of 60, those folks count as senior caregivers, and those individuals have no way to plan for their future when their long-term caregiver, that's usually a mom or dad or a sibling or an aunt or uncle, sometimes grandparents, are no longer to provide care. And we have got to plan for that group. In addition, we have a lot of people with developmental disabilities after school who want to try living independently in the community, and they don't have very many opportunities to do that because we don't have sufficient housing and other options for them. So a pretty significant group of us have been meeting over the summer and in the fall with legislators to talk about those barriers. We need an increase into the DD set aside for the Housing Trust Fund. We have been talking to them about $40 million, which would be about 10% of the overall Housing Trust Fund money currently. We've talked to them about how many homes that could build, what that looks like, and making sure that legislators understand we need housing in every single community. It is not okay for someone who lives in Grays Harbor to have to move to Yakima in order to get access to housing that they can afford and that is appropriate for them. There are a couple of things that we emphasize when we meet with legislators, and that is people with people with developmental disabilities live on SSI primarily as their basic source of income. That leaves them about $200 a month to contribute to rent. That even in low income housing standards puts us in the extremely low income category. And there are not houses in the low income category sufficient for people at that income level. We don't have enough vouchers for those individuals to have market rate housing. And we have some people with developmental disabilities, people right now on a core waiver, frankly, because they have higher needs, who are unable to use their waiver and get a placement. So we've talked a lot about what that will take. Our housing is more expensive generally. We like to say that we don't perform well by commerce standards because we are only serving a small number of people in housing that costs a little bit more to build. And that makes us not very competitive in the overall Housing Trust Fund scheme. So Commerce, we're asking to be a very good steward of the money that they hold for us and make it easier for smaller nonprofits to develop housing for people with developmental disabilities, and to make sure that that money gets spent, that they understand what the barriers are. So we are having great conversations with legislators, including with folks like Representative Jamila Taylor and Representative Chop, Senator Kuderer over in the Senate, and making sure that they understand our barriers to housing, that we need more funds in the Housing Trust Fund, that we need Commerce to work with us closely, making sure that those funds are spent in the community.
Thanks, Stacy. We also have another page on housing. Is anyone here from Open Doors? I looked through and didn't see anyone I knew from there, but do we have someone from Open Doors for Multicultural Families to speak about this page? Okay, well, I'm just going to cover this briefly, or, Stacy, if you have anything, chime in. There's an extra concern about housing for people with intellectual and developmental disabilities, and that's with the BIPOC community, which they have their own challenges with the system to begin with. But it's even more different when it gets to housing. And Open Doors for Multicultural Families did a survey, and they, were checking with people to find out what their needs were about housing. And 24% of the households said that they were at risk of losing their home. 81 had financial hardship with trying to pay housing costs. 54% are low income. And many of them are in other cultures. Sometimes the families live together, and there's not very many 3+ bedroom apartments out there for families that want to be living together. There's people with multiple disabilities, and they need a variety of housing because it's just not meeting their needs. And when you talked about asking people, with the people with disabilities, did they want to live at home or did they want to live on their own? The answer was they wanted to live at home more. And I think in the Caucasian communities, it's much more about being independent on my own, but it's part of the cultural piece of housing that we're not looking at all. And Stacy put in the chat the DDA housing report, the one that just came out. They have 2 of them, and we're going to look at those in a little while. Okay, so did anybody have questions on housing? Okay, let's go.
I had a question.
Oh, sorry, Alex, I didn't see you there.
It's all right. I was wondering if I don't know if this is for all counties or areas, but I know in our particular county, there's an assessment that goes out every year from the community. What do you call it? The community needs assessment, and people are not looking into that. So they should talk with their community services or county representatives somehow and figure out in each individual county where they're getting the representation from, because they really need, if they want the broad enough info, they really need to hear from our community, because they're not getting the information out that they need to, because they need to do this annually every year, that they need to do the community needs assessment, and they're not getting the information out because they don't know about our community. All they focus on is like the mental health and homeless crises. They don't know about the DD community, and they need somebody from our end to explain to them what services we need and how we need to be treated.
That's right,
That's
Alex.
the only way to change the culture here.
Right. And I've shared with DDA there's a self-assessment that Alaska does up in their state for all people with IDD. And that would help them a lot in understanding what the needs of people are now and what's going to be their needs in 1 year and what's going to be their needs in 5 years. I mean, if they're in school right now, they aren't going to need housing. But in 5 years, when they are out of school, then they're going to need that. And DDA has no idea of people's needs in that respect.
And
And
I,
the people in general don't know us.
Right.
right. Alex, it's an excellent point. And I always encourage people to get involved in their city council meetings, their county council meetings, to make sure that people with developmental disabilities are showing up and letting those local organizations know about our needs. And so
Right,
I'm really
and
glad that you made that point.
In our county, I made a point because they said people of abilities or something like that, and it wasn't as specific as we needed it to be. So we had a talk with our representative, which is Rebecca Royce. She's the nicest person on earth, but if you get on her bad side, it's not good. But anyhow, we had a long chat with her and Michael Torres, the program manager who does the Community Housing Action Development Unit in our county. We had a long talk and we said, hey, look, you need to make sure that IDD community is in there and not just abilities.
Beautiful. Everybody
you,
take a
Alex.
note from Alex. Please take a note from Alex. And you know, what I tell people that I meet with in cities, they want to know what role they play. Certainly making sure that they're looking at their zoning issues and land, same with the counties. So when you're talking with cities and counties, those are two issues to bring up potentially.
Okay, so Stacy, you wanted to talk to us about the 1115 demonstration waiver.
Yeah, so I put in the chat a report that the state legislature asked for and got at the beginning of the pandemic. So in the pandemic, taking away time and energy and effort, of course, from HCA, this report sort of got lost. We've been trying to resurrect it ever since. To say to the healthcare authority, you have a report that gives you direction to apply for an 1115 demonstration waiver to ensure that working families who have employer-based insurance can buy into Medicaid so that they are insured coverage for their children who are medically complex. There are a lot of families who apply to DDA really to get access to Medicaid because that's what they need when their children are younger. There are a lot of families who cannot make the income requirements, who have insurance, but still go bankrupt or find themselves in a situation where they must get divorced to be eligible for Medicaid in order to cover their child's needs. This is an option in the state Medicaid plan that we just have not checked the box on. The legislature is aware of it and has been willing in the past to look at a 1,000-person pilot potentially to see how this might go if we opened up a full waiver. A demonstration waiver, of course, is sort of an experiment for the state to see how much it costs, what the sliding scale might be for a copay for Medicaid for those working families, how many families are really utilizing it, and what the overall cost would be from the state in order to get the federal match. We think that this is a very pressing issue. We have a lot of stakeholders by our side who are in the palliative care, emergency, NICU units, and hospitals that are trying to make sure that we have adequate resources for these children in hospitals, as well as making sure that their families remain whole as they go through these ups and downs of needing medical care for their child's lifetime sometimes. So that's it on this particular issue. We're working hard to see if HCA will take us up on making sure that they apply for this waiver.
Great, thank you so much, Stacy. And our next subject is going to be about supported living, and I'm not seeing Scott here. Randy, are you going to be speaking to this? Not sure who from CRSA, Community Residential Services Association, is here to talk about their page.
I can do that, yeah.
Okay, great. Can you start your video there?
I don't have a video on it. Can you pull it up?
Yes, just a second. Let me get you in there. There we go.
Alrighty, thank you. I'll try to be brief. My voice isn't great right now. And so community living, or sorry, CRSA, we're looking at an increase that we didn't get from last year. So we did get an increase to increase wages, which worked out really great. It helped us provide some staffing. However, didn't receive any money for admin dollars and that kind of thing to help pay for the other expenses that are needed to be paid for. And so with that, we are asking for an 8%, I don't see it on here right now, 8% increase over the whole entire rate that we have. So we'll cover both employee wages and then also the admin part of our expenses. We need to do this in order to keep up pace with minimum wage. As we know, minimum wage goes up every single year, and it goes up to like $15.70 something, I think, in January. And so we need to be able to keep pace with that. And so that's where that increase is coming from. And I know I can't see the bottom of the page. Can you move it up a little bit?
Sure.
Thank you. And the second piece of that is to reinstate the COVID-19 enhanced rates. As we know, that's still an issue for all of us. So, and right now, our rates that we're getting for COVID enhancement is running down. Yet there's still CARES Act money coming into the state, and so we're hoping that we can participate in that funding as well. I think that's really all I have, and sorry.
No, you're great.
It is a little
in fact, you're helping us get back on track. If anyone has any questions, on the bottom of all these pages are the people that you would contact if you have more questions. Randy is on here, and Scott is on here, as well as their lobbyist, Melissa Johnson.
Yeah, please feel free to ask any questions, and we'll try to get those answered. Thank you.
Thank you, Randy. Okay, so next,
Diana.
Yes.
Diana, it's Margaret Lee. I just want to tell you what a great job you do on these pages. I mean, they are just perfect.
Thank you, Margaret Lee. This is a passion. I love putting the notebook together. So it's kind of easy for me in some ways. Let's see. And Kathy Murahashi, are you here today?
I am.
Okay, great. You are our next speaker. And
Okay.
I will pull up your page as well. Let me get you spotlighted there. And,
Thank you.
whoops, got to pull it up first.
Well, I can go ahead and start talking. I think
Yeah,
when she
go
pulls it
ahead.
up.
Yeah.
Good morning. So I'm talking about adult family home recommendations. You know, we have a lot of folks in adult family homes who have IDD. You know, adult family homes are what we call DDA's go-to model for people with IDD. The problem is that we don't have very many adult family homes that are created specifically for people with IDD. So there's a lot of people that end up in adult family homes that are, you know, for people that are elderly. So you may have one person with IDD with 4 people who are elderly. Now, if the person with IDD is elderly, that's probably okay themselves. would be an inclusive community. But for our younger folks, that's not a great model. And so for the last few years, we've really talked about, that we really need a push for a DD, kind of a contract specifically for people that are serving people with IDD. And we had a really nice stakeholder group, and we had some really great ideas, and some of those ideas are there. And kind of nothing happened with it. But the really good thing is that this year DDA put forward on their decision package a pilot to see if they could make this happen. Now, so what we really need is for people to talk about the legislature investing in that, to try that model, how we can make better adult family homes that are, more specific to people with IDD. Along with that, we would really like to see, let's see, the rate that, the Adult Family Home Council negotiated for increased rates. And so we would like to see those rates go up, because they're pretty low for our folks. And it makes it really hard for small AFHs to continue because the rates are so low. Also, there's a little bill that we're trying to get through that will help small nonprofits that are adult family homes be able to have a tax exemption for property tax exemption for their homes. There was a little glitch that came up that used to be we could, and there was a glitch that came up that we need kind of to have fixed. And so we're hoping to have a legislator work on that. So anyway, we think that, adult family homes are part of the solution to the housing crisis. It's not all of the solution. As I said, adult family homes can be really great for people with IDD, but they're not perfect for everyone. But we need to make sure that we invest in ones that are appropriate and well-served folks. Okay.
Thank you, Kathy. Great job. We've got a lot of different issues to hear about today, as you're seeing. And so I want to make sure that we get time to ask questions, but keep them brief. So did anybody have questions for Kathy or Randy about housing, supported living? Okay, so we're going to move on to our next one. Oh, Justin, I'm sorry. I see you got your hand up now.
It's all right. I was curious about something. Now, I know that houses are expensive, especially for people with IDD. And I was wondering, would there be some kind of a contract or something where a person who doesn't make much money to be able to get into a certain program and become like renters or owners of a property?
Yes, there are programs like that, Justin. They're usually centered in several distinct counties. I know King County and Pierce County and in Spokane have home ownership programs, but I can talk with you later about that if you'd like to and get you connected.
Sure. I mean, my county doesn't have that, and I would like for them to have that.
Well, let's look into that for you later, okay?
All right, thanks.
So now we're going to move on to employment. And I believe, Courtney, we have you here to talk about the provider rate.
Hi, yeah, thank you, Diana. And I just want to echo all the comments and the chat box comments. You are incredible with how you organize this. And I know it's in partnership with DDC. So thank you so much, Brandy, and thank you, Stacy. You are all doing such an incredible job. I'm here to talk a little bit about employment service provider rate increase we're seeking from the legislature. I'm Courtney Williams. I am the executive director for the Community Employment Alliance. I'm slowing myself down now, not needing to remind as I get out of breath talking myself. So this year, for our 2023 legislative priority, we're seeking a continuation of what we asked for last year. So if you all recall, last year, we saw a provider rate increase based off of the Consumer Price Index and statewide school to work. Through the legislative process, those two asks became one bill. And in the final hour, the rate was removed from the bill. And in turn, we got a legislative study asked from the legislature to DDA. The legislature study has been concluded. It was released in October. That has been sent to CAC, and I think Diana's distributed it out. But if not, I'm happy to do that. If you simply email me, I'll put my email in the chat box. But
Well
we're
done,
asking.
Courtney.
Oh, I'll slow down. I'll put my email in the chat box, but what we're asking this year is for the legislature to fund what that rate study has showed. And so the rate study has been completed. We are seeking that rate increase based off of the rate study. There was a huge process with how this rate study was comprised. And what I'm most proud of was, the aftermath. That for a really long time, the legislature and our community, including folks who struggle with understanding all the moving pieces when it comes down to what goes into an hourly rate. What exactly is it? What is employment service? My goodness, $84 an hour, that is incredible. That's a lot of money. But I think what, often is misunderstood is really the reality of what happens in that hourly rate, what's not paid for. And this rate study is a really flawless report. It finally shows really what is behind the scenes when it comes to employment service providers. And more importantly, the quality of services that providers are trying to maintain. Through the work of you all, there was a lot of incredible legislation that was passed last year and years past that is now going to be up to providers to be able to provide. And with the rates as is, it's just not sustainable. So we're really excited and we're hopeful this comes to fruition. It is due time, and I'm here for any questions anyone might have within my time allotment. I know I can't take the whole time. And I see, Karen, if you're on, you want to fill in anything that I maybe missed?
I don't hear anything.
Okay.
Okay, and I don't see any hands. And so let's get moving on to our last piece here, and then we're going to take a break. And that has to do with the RHCs, the residential rehabilitation centers. And this legislature is going to have to deal with a lawsuit against the state about Rainier. And so Self Advocates and Leadership has put together a bill that they're going to be moving forward. And I don't see Ken Larson here. Jessica, would you like to speak to this? You're on mute. Okay.
Yeah, I can speak to this. Or is Anthony Nash on?
What's that?
Anthony here or Ken?
I think Anthony is, at least he was earlier. Ken is not here. I've been watching.
Yeah, I am.
I thought Ken was here, but Anthony, you can talk about this.
Okay, yeah. Sale has actually been, at first Sale was trying to run a bill that would close all the RHCs at once, where we were trying to get all that money, but now we're kind of doing it like one at a time so we can try to keep people sheltered but bring them in our community. So Sale has been running a bill and we changed it a bit, and we're wanting to try to advocate and close down Rainier School because they have so many violations from feds and state level now that they're just being let go. And there's all those people. So we as SAIL members are trying to advocate to get that funding to be put into the community so that they have a home. And we're trying to get all our legislators to do that.
A sponsor for the SAIL RIC bill. And I'm working on that now. So I'm hoping either Jamila Taylor or Daria Farber will take it out of SAIL and help us sponsor the bill.
Yeah, and we also have an RHC committee so we could try to get an improvement on the bill too. And it's called the Close the RHC's Committee, and any self-advocate or anyone can join SAIL and be a part of this committee. It's open for all self-advocates to be part of.
Any questions for Jessica and Anthony on closing Rainier School? All right, well.
Diane, I just wanted to let people know, and I put in the chat that there's word today that Pat C at Rainier School will be closed in July 2023. So DDA will be working on plans to address the needs of the individuals that are still there.
That's good news.
That is good news. It makes less that you still have to worry about closing. Well, thank you, Jessica and Anthony.
Yep.
And we have Senator Wynn is scheduled to speak with us. I don't see him in the room yet. So I think that probably what we'll do is we'll just take a 5-minute break. And I'll watch for him, and then as soon as we come back from break, hopefully Senator Wynn will be here to speak to us. So take a 5-minute break, go stretch and grab another cup of coffee or water or whatever you need, and we'll see you back here in 5 minutes.
And you can always grab a latte, Diane.
I don't have a latte maker.
We'll see everybody at 11:15.
Oh, I see Senator Wynn is just coming in. Good morning, Senator. Maybe I lost him.
Hello, everybody.
Oh, hi, there you are. I lost you. I'm trying to find you in my list to spotlight you.
Oh, no worries. You get it?
No, what did you come in under?
Joe.
You did, and I see Joe Cunningham there, but I don't see you. Why? Oh, there, I found you. There you are.
Awesome.
All these little technical difficulties go along with anything we do, it seems.
It's all good. I think folks are used to it hopefully by now.
Yeah. Well, I gave everybody a 5-minute break while we were waiting, and so they'll be back in a couple of minutes. And do you have time to wait 2 minutes?
Yeah, you're okay. You're okay.
Okay. Well, we'll get back to you in just a minute when people come in. And
Senator Nguyen, this is Stacy Dim. I just want to say thank you again for coming today. We're really
Yeah, of
grateful.
course.
We're excited to hear about what committees you might be on. Do you know
Uh,
those yet?
It is public now, but yeah, I'll be happy to share.
Okay,
good.
sounds great.
Is there somewhere where we can get the committee list now? Then is it posted?
I don't know what website is on. If you go to Twitter is kind of where I think most folks.
I'm
Sadly.
always telling people, go to social media. That's where all
Yeah.
the news is.
I saw somebody post like a screenshot, but I don't think it was on an official website.
Okay, well, we have a part of this notebook that we're going through. There's a section on legislators, and I usually update it about now after the committee designations come out, so the advocates know which committees their
Yeah.
senators and representatives are on. And I had the leadership, that part has come out on both House and Senate, but I didn't get.
The House is not out yet. The House is still being worked on. So you may have one from this last cycle. There'll be a bit of change to this next one. And it's not you. Nobody has it. So this is all very fresh.
Well, they got a lot of new members in the House that they have to try and rearrange things with.
Yeah, I think
Then
almost
they didn't have so much
third.
movement.
Yeah.
Although you did get some new senators in there.
We did.
Hoffman and Senator Shoemake.
Yep.
They're going to be real helpful in this next session.
Yeah. Javier Valdez, that's on our side. Even on our side, Matt Banky is actually a good guy.
Yes, and
And-
we're familiar with him.
And I don't actually know Nikki, but I heard she was reasonable. So hopefully that's another one as well.
Well, we're getting a lot of the younger generation in here too. That
I mean,
have more open ideas.
there's no other option, right? So it's like, I think the average age is probably 80, so you can't get much more than that. So,
Well, this is going to be, a very different legislative session. I know originally they thought the forecast was going to come out negative, but
Yeah.
it's now a little bit positive. So that's a good sign.
yeah, nearly 900 million.
Yeah.
Hey, Diana,
Yes. That's
who
the-
is this representative of?
He's Senator Joe Wynn.
And Diana, it's
Okay.
it's 11:15. I think we can go ahead and hop back
Great.
on as some people will get on, and then maybe you could introduce Senator Nguyen.
Yeah.
Okay, well, welcome back from your break. Hope you had a good stretch and got something to drink. And we are going to keep moving through our agenda. And we are pleased to introduce Senator Joe Wynn. And I'm going to let him take the floor and talk about where he's from and what's going to happen.
Yeah, well, hopefully, just a one sliver, but I'm Senator Joe Wynn from the 34th Legislative District. And that includes West Seattle, White Center, parts of Burien, Vashon Maury Island, Soto, parts of the waterfront, downtown Seattle, Highland Park, Georgetown. It's kind of an interesting district to represent because I have heavy industries within the ports and Soto, and I have Vashon Island, which is a rural community. I have urban areas, literally downtown Seattle, and I live in West Seattle with my family as well. And it's an honor to be here. And we just made our selections for the committee. Diana had mentioned it earlier. So this next year, I'll be serving on as the chair of the Environment, Energy, and Technology Committee, which is incredibly important. So you think about Washington State, you think about technology, you think about energy, you think about climate change. So I'll be leading up those efforts next year in partnership with the governor. I'll still be on human services as well, which is a passion of mine. I don't think I would ever want to leave that committee just because of the work being done there is near and dear to my heart. And then I'll also be serving on the Ways and Means Committee. So historically, I had been serving on the Transportation Committee. We did some transformative work last year to move what's called Moving Ahead Washington, which is a great progressive decarbonization transportation package, probably the most progressive in the history of Washington State for sure, but potentially in the United States as well when it comes to forward-thinking transportation. And it looks like I need to slow down.
Yes, our interpreters like us to talk a little more slowly so they can interpret.
No worries. But I am very excited to get started. So I'll answer questions or whatever format you thought would be appropriate.
You mentioned that the committee members list is out and you know which committees you are on. Have there been any changes to the Senate Human Services one?
Yeah, some pretty significant changes. So Senator Saldana, I think, is coming off. So it'll be Senator Wilson is the chair. Senator Yasmin Trudeau, I think, is the vice chair. Myself, and then Senator Kaufman will be coming on to the Human Services Committee.
Oh, that's a great list that knows our issues.
Yeah, yeah.
Did anybody else have questions for Senator Nguyen? Maybe you could talk just a little bit about the budget forecast, and is there any kind of high priority that the legislature in general has that we might see as something we're going to have to make sure our voice is heard, maybe within it, or?
Yeah, so the positive thing with the forecast that came out is that it was higher than we had previously expected a few months ago. So it's about $800 to $900 million more than what we had expected. The downside is that the costs will also be higher as well. Some of the forecasts for the caseloads that we have will likely be higher. So net, I don't think it'll be that much more. But the reason why I say it's important is because when you look at things like inflation, affordability, access to basic needs programs, those resources have been constrained, agnostic of that budget. So I think next year there's going to be a very concerted effort around affordability, around even some of the investments that are being made at the federal level. So the federal government over the last year has allocated a lot of money as it relates to the Inflation Reduction Act. So how do we utilize that appropriately in Washington State as well? But also, how do we start moving towards a mindset of a pandemic and one that's more transformative and long-term as well?
Great. Well, and we'll be, working to talk a lot about the caseload forecast for Developmental Disabilities Administration, DDA. You received the forecast. We've seen that. And it looks like we don't need anything based on what they were using. They had asked for a request list, and in DDA, the request list is just one of many pieces where people are waiting, and it's one of the fewer ones. We have over 12,000 on no paid services caseload, and because they haven't had any case manager since 2011, they had no idea they had to ask to be put on a request list. So those 12,000 plus people are sitting there not knowing they had to go on this request list, which is what the legislature looked at. And it looks, because the legislature gave money to DDA to take people off those request lists, that happened last year. And so now it looks like there's no need. When in reality, that's not at all. We've got the 12,500 on the no paid services caseload, and there are people sitting in the residential rehabilitation centers that have federal funding to move out, 75% match, and yet 83 people sit there in those RHCs waiting to get out in the community, but there's no place for them to go.
Yeah.
And 27 of those folks have been waiting over 2 years trying to get out. And we've got the people that are sitting in hospitals with no medical need. They're waiting to get a place in the community. And a lot of this comes down to housing not being available. And that's, I know, a prevalent problem for everyone around the state. But it gets even harder for people with IDD because they not only have to have the physical housing, the brick and mortar, but they also need the care providers to come in and provide the care that they need. So, you know, it's kind of a double process there. And we need to make sure the DD voice gets heard in all these housing discussions that are going on. And so we've been trying to meet with.
See, Alex has his hand up.
Okay, Alex.
I have a comment and a question after. My comment is you need to build the foundation, and the foundation starts with transportation. How are people going to get places where they need to be if they live out on their own? First of all, a big major thing is the I-5 bridge. It's the majorest thing on earth. You need, the legislation needs to focus on that in order to focus on us. And we need to make sure that we have a sustainable bridge. In case of an emergency, we need to be able to get over to Oregon, Idaho, anywhere else out of Washington if there's an emergency. And right now we do not have a sustainable bridge. It's 106 years old and it needs to go. We need to focus on that. If we focus on that, then we can focus on the other things that come along with that. Employment, housing, everything else like that. Transportation is number one and is number one. If you don't deal with the problem there, then you can't deal with the other problems. That's my major concern, and that's my spiel, and I'm sticking to it.
Thank you, Alex. What's interesting is I actually was meeting with one of the transportation department leads for Oregon. So Washington State and Move Ahead did fund the replacement of the bridge between between Portland and Vancouver. And now it's up to Oregon as well to kind of up their ante. So that is a work in progress. In addition to other, obviously, transit needs as well.
That's wonderful. Does anybody else have questions for Senator Nguyen? I'll make sure I'm not missing hands. Well, thank you, Senator. We're so appreciative that you were able to take some time out today and come and visit with us and talk to us and learn from us. And you know, if you have any questions, you know, the ARC and the Developmental Disability Council are there to help with anything that you may need.
No, perfect. Thank you so much. I appreciate all the work that you're doing, and I'm looking forward to seeing folks hopefully in person this next session.
Yeah, that's what we're hearing. Oh, Margaret Lee put her hand up.
Margaret, you might be on mute if you're speaking.
Yeah, I am.
There you go.
Drives me nuts getting older. Senator Nguyen, my memory is that you have a lot of experience with people with intellectual and developmental disabilities. And I just kind of wanted you to take 3 or 4 sentences and tell everybody here so they know that.
Yeah, so my father, first off, well, both physical and mental. Was my father, when I was younger, was in a car accident, left him quadriplegic. So I grew up in a situation that required us to have a lot of the services that you're advocating for and need. And I've seen that just from a provider perspective. I was his primary caregiver, and also as a son as well. And I've had family members within this community as well, and seeing kind of the resources necessary to ensure that they have a healthy and prosperous life. I've worked a little bit with Banchero Group. They're a provider of services and housing for folks in the DD community as well. And this just happens to be an area that I think is very important, that I want to make sure that we have visibility on and investments towards as well. Thank you for bringing that up. That was a nice softball question.
And there's a lot of comments in the chat for you, Senator Nguyen. A lot of people are appreciative of you coming here today.
No, thank you. Well, thank you so much. We'll talk soon. I appreciate all your work.
Thank you, Senator. Have a great day.
You too.
Okay, so we are going to move on. Do we have Ken here yet? Did he come in, or Jessica? or Anthony?
Me and Jessica are here.
Okay, well, let's have you guys talk about the Nothing About Us Without Us bill that we're working on. Didn't pass, so it'll have a new bill number this year.
Diana, I am here.
Oh, Ken, you are here.
But I'm gonna let them do it, because I have a nasty cold, nasty, I've just been real,
Oh, I'm sorry.
I've been really ill and I have absolutely not real good voice, so I will allow them to do that if it's fine.
Well, we're really glad that you were able to make it.
But I am in here, so yeah.
So I can go ahead and speak on this.
Okay, go Jessica.
Nothing about us without us is about balancing control. People with direct lived experience should be at the table and not have people speaking over or for them. No one has to leave the table, but there should be equal footing. Anyone with direct lived experience is someone with first-hand experience to the experience on the topic at hand. You have had the lived experience of being a family member of someone with a disability, but unless you have a disability yourself, you can't have lived experience with disability yourself. We've been talking about this bill in the context of Nothing About Us Without Us related to work groups, task forces, things like that. There may be task forces where a parent's lived experience as a parent might apply. But the focus last session was on the fact that people with disabilities have been excluded from conversations while their parents have often been parts of these conversations. People with disabilities have a much better idea of what they want as solutions and a better idea of what will work when talking about broadening the definition of DAWU. We could be talking about the task force has defined as what they're trying to do, and people who have lived experience or are directly impacted by that. The best way to be an ally is to listen to the people in the community that you are trying to support and follow their lead.
Do people hear that?
It was kind of soft, Jessica. If you can send me your script, then we can send it out to everybody so that they can hear.
I can do that.
Great. Did anyone have any questions for Jessica or Ken or Anthony? I'm sorry, Ken, that you aren't feeling well. I know this was important to you today.
Yes, you want everything? Or
Okay, let's move on to our next issue. This has to do with the parent-provider inequity. And Whitney, are you on the call today? Yes, I see her there.
I am. Hi. And I apologize. I'm on my phone, so I cannot share my screen. So if someone else could do that to help me out, that would be great.
Yes, I will share the page for you.
Yeah, so this issue of parent-provider inequity, I think this is a conversation that has been going on for a while, and I keep hearing it brought up among parent caregivers, especially parent caregivers of young children that have a lot of support and medical needs, and especially in the context of the lack of formal providers and skilled nursing shortages. And so this idea of parent-provider inequity in Washington State is that currently the parent caregivers of adult children over the age of 18 who provide support can be paid as caregivers, and the parent caregivers of children, teens, and youth under the age of 18 cannot be compensated as care providers, even if they are performing the same tasks, and even if that individual youth qualifies for personal care hours and support hours. It is simply that parent caregivers are divided into two classes, one that can be paid and one that cannot be paid, and that is based solely on the age of the DDA Medicaid client, without concern about the services provided or the parent caregiver involvement in that. And so the solution that we have come up with is that it would require a modification of the WAC. It is there on the screen, and it's simply to change language that would not distinguish between parent caregivers of individuals over age 18 and those under age 18.
Did anybody have any questions for Whitney about this issue? Okay, well, thank you.
Diana, can you hear me okay?
Yes. Go ahead.
Oh, this is Stacy. Whitney, I just had a question. Sometimes people bring this up, and there's a concern that this would cost a lot more money. And the response that I've heard you and others make, which I think is notable, is when you think about it, the hours are approved for someone else to care for your child. And the difference is only whether it's you or someone else providing it. And in that situation, it may not necessarily be that much more to implement this. Is that something that you've explored a little bit more?
That's right. I mean, these are hours that are already approved. Currently for my son, he is approved for a good number of hours. And as it stands, my mother, his grandma, can be his paid provider, but I cannot, solely due to the fact that I'm his biological parent. You know, and it also is regardless of the fact that parent caregivers are often better trained and would in fact be probably better providers. But yes, these hours are already approved. Technically, the money is already on their account, and so by that reasoning, it shouldn't cost any more than what we would assume it would if there were sufficient providers that were providing those hours.
Thank you. And again, the other point that I've heard you make is that there are just so many parents, moms and dads, who end up dropping out of the workforce in order to care for their son or daughter because they cannot find sufficient care, that this seems like a reasonable alternative as we're having this workforce shortage for sure.
Absolutely. And I think, that economic issue is a whole additional point on this, is that parent caregivers needing to drop out of the workforce to take care of their children because they can't find the support needs that child needs at home. It can be economically devastating for the entire family, and it often falls on the shoulders of women, and so we're really looking at a very gendered issue as well.
Thanks for those clarifications.
Yes, and Whitney is part of the Washington for All Families Coalition, and in fact, she put it together. And so her information to contact her if you have questions is on the one pager in the notebook. Any other questions for Whitney? Okay.
I just had a quick 20-second comment, and that was money does not grow on trees. Where are you coming up with this money?
The money is already existing. It is already put on that individual client the same way as any other care provider would be placed on that individual client.
How are we getting the money anyways? Because money does not grow on trees.
Yes, clearly money does not grow on trees, but it is money that is already put on it as
how did you get that money to begin with?
This is
That's what
DDA
I'm
money.
asking.
It's exactly the same amount of money as you would be providing any other individual. How do we get money to provide compensation for adults with disabilities? You're asking the same question. Why should youth with disabilities be treated any different?
Thank you, Whitney. Okay, we are going to move on. We've still got a number of things to do before the lunch break, and we have Jamie Bond from DDA coming today to talk about their budget asks. Debbie Roberts was not able to make it. She had an emergency come up, so Jamie will be filling in for her. The next issue we're going to talk about is parity of placement. This has to do with supervision hours that they get covered if the person lives out of their family home, but not if they're in it. Sandy, did you want to speak to this? Sandy Gruberg, are you
Sure,
here?
yeah, thanks. Thanks, Diana. This is Sandy Gruberg. I'm with the Pierce County Coalition for Developmental Disabilities. I'm also a parent provider myself for my disabled daughter, and I also represent a few of the Washington State parent coalitions and am doing work with the family caregiver group in North Star. So I think Diana said it as succinctly as I would like to say it, that parity of placement or parity of place is a terminology that was utilized and coined, I guess you would say, by Adrian Stewart, who worked with the first North Star group. And it really does talk about how the supports a person needs should follow a person no matter where they live. Yeah, I need to slow down for the interpreter. Thank you. Sorry, I am talking slow for me, but not for you. So, anyway, a person right now who is assessed to have need for supervision as far as safety support, someone who is assessed to not be able to live alone, or not live alone, but be alone, be left alone. That money right now is not being provided, or those hours are not being provided if the person lives either in the family home or in a shared living arrangement that is not a state operated living alternative, is not an adult family home, and is not supported living. So for instance, if someone was doing the DDA assessment and their hours turned up to be personal care hours only, so things like bathing, toileting, shopping for groceries, those were, say, 4 hours a day. If they were living in their family home and needing that level of support, but also couldn't be left alone for safety reasons, they would only get those 4 hours a day of personal care. So what happens to the rest of the day? If someone has to hire a caregiver or the family has to go to work, what happens for the rest of that day? If they were to, same needs, same supervision need, go into an adult family home or supported living or a state operated living alternative, a SOLA, they would be provided with that supervision. So often what happens is someone goes from being on a DDA core waiver and getting supported living to maybe that doesn't work out for a reason. Maybe there's a change in provider and they do wind up back in the family home, either by necessity or choice. There is no supervision paid for. There is only personal care or other waiver services that get them out into the community. So our concern is, why is that? Why is it that someone's needs apparently change in their living setting? So our solution, and again, this comes from, I should back up a little bit and say this comes from brainstorming sessions with the North Star Family Caregiver Group. It comes with brainstorming sessions from Parent Coalition, but the name that I could put on this as contact was myself and Darcy Ladwig, because we've been listening to these concerns of families. We've been listening to this in those environments. So this isn't something that is a position statement from North Star. We don't have a bill that we're asking for. We're just saying, here's some information that we would like legislators to consider as they look across at caseload forecasting and they look at across at waiver needs, at service needs. Where are we talking about providing service for those who are unable to be alone safely. So our solution, again, just a brainstorm, this is not a bill at this point in time, is to direct DDA to assess and pay for safety supervision hours for individuals who live in the family home. That we don't know how they're going to do that. We're not going to direct them with how to do that, but we need that. People need that. It again comes to that same issue that Whitney talked about, where if a parent has to leave the workforce, I had to do that myself in my past career, leave the workforce to provide supervision for a loved one who cannot be left alone. How does that economically affect families? How does that affect an individual? So we really want, who's not getting the care they need, and any care they are giving beyond that personal care is unpaid. You know, so this is an equity issue when you're looking across the system. This is the person. Their needs do not change with the setting. How do we create equity with how DDA is responding and caring for that person? The other thing that we thought of as an idea, again, we don't want to tell them how to do it, but we want to tell them we need it, is to offer core waivers to individuals living in their family homes or in shared living. Right now, people living in the family home or in shared living are just, they're just receiving personal care hours. They may be receiving something like community engagement or specialized habilitation or employment, but none of that covers that safety support. So that's kind of in a nutshell. I could go on and on with all the different groups that have been researching this, but we wanted to just, this wasn't something that was being brought to attention by any other group. So we wanted to go ahead as an entity that is just starting to brainstorm these things to be able to give this information to legislators and let them start thinking about it.
Well, thank you, Sandy. Did anybody have any other questions for Sandy? I see there's a few comments in the chat that you might want to take a look at. Okay, our next speaker is Ramona Hattendorf. Are you here? I didn't see her in the list anywhere. I couldn't find her. The next issue that we're going to talk about has to do with sending children out of state for education. And unfortunately, in our state, that is how children who may have difficult behaviors for school districts to try and figure out how to work around. Instead, they send the kids out of state to residential facilities in other states. We're going to see this a little bit more in the chart section when we get there. Last year in the budget, that it was supposed to be that OSPI, the Office of Superintendent of Public Instruction, would collect the data and provide it to the legislature about these kids being sent out of state. But the governor vetoed that part at the request of OSPI. And we have people who have done, requests for that information and gotten it. It's not that the information doesn't exist. And I think Tanya May touched on that a little bit too, that they know they need to be doing this. These kids, the cost is like up to $650,000 for a year for one child to be taken care of. And in our state, a few years back, we had kids as young as 7 years old being put into our state institutions, and the legislature finally realized that was not a good idea. And so children are no longer allowed to be placed in institutions in our state. But instead, we're sending them to residential facilities, which is another type of an institution, out of state because it's not available here in our state. Doesn't mean we need to make it available. What we need to do is get school districts the tools and the staffing that they need so they can help children learn no matter what their disability may be. And the page is in the notebook on our website there, and Ramona Hattendorf, if you have more information, have questions or need more information, you can contact her, and she put a couple of other documents on her page that you can refer to as well. So let's see who's up next. Stacy, you were going to talk about the burden of proof. Can you give us a little information on that?
Yeah, of course. Fortunately, Professor Brodoff couldn't be available today, so I'm happy to cover this topic. In the state of Washington, when a parent has a disagreement with their IEP on behalf of their child, sometimes they end up in what's called an administrative due process hearing. And right now in our states, that is a difficult path for families for a lot of reasons. In most instances, parents are not represented by attorneys. They often can't afford them, and school districts have an automatic access to attorneys through an insurance pool that most of them join. In addition, there is a process within administrative due process hearings that lays a greater burden on one party over the other. And in this case, the burden is laid on the family to prove that the child did not receive an appropriate education. It's sort of the flip side of looking at what could happen otherwise, which is that the school district would first have to demonstrate that they provided an appropriate program that showed the student benefit. In our state, many years ago, there was a Supreme Court decision that allowed states to sort of choose and rejigger how they go about this process. And Washington puts the burden of proof on parents, which we believe is very difficult for families to achieve, especially when they're not represented by an attorney. School districts hold all the data for a child's progress. School districts have the access to the classroom. Parents do not generally have good access to the data or to the classroom in order to present their case and put on their case. Parents have to pay for an independent expert to come in, and those costs are not covered by the cost of litigation, generally speaking. It just continues, the way this is set up continues to make it very difficult for parents to demonstrate that their child may not be benefiting from their students' public education. We have asked for OSPI to consider a change in rule voluntarily that would shift this over. Multiple states have burden of proof that lies on the district. And some people ask, well, is the goal of this so that parents win more due process hearings? And actually the goal of this is to make that situation more equitable. In addition, to give school districts an incentive to settle these cases sooner. What we find now is, because districts are in such a strong position going into hearing, they're really sort of in defense mode. They have very few incentives to settle these cases quickly. And we know that that gets changes in educational programs to kids the fastest. Usually not every remedy, of course, is legal. Sometimes these are relationships issues. There are a variety of issues that might come up that could be resolved if school districts are willing to settle sooner. And so this is something that a large group of advocates have been approaching OSPI about and hope to get some sort of voluntary resolution. Short of that, they would be talking to members of judiciary committees and potentially the education committees to see if they would agree to this sort of change.
Thank you, Stacy. Well, our last three issues under the one-pagers are going to be done by Noah Seidel. He's here from the Office of Developmental Disabilities Ombuds. And let's see, you've got three issues that you are going to talk about today. Let me pull up the first one here. And it has to do with inappropriate hospitalization. Do you want to talk about that?
Yeah. Hello, everyone. I'm Noah Seidel with the Office of Developmental Disability Ombuds. And a quick visual description for folks who can't see me right now. I'm a white person with black glasses, black hair, and a scarf and red sweater on today. So I'm going to talk about a few issues, and many of these issues overlap with what many of you were already talking about. So we'll also be supporting all the legislation that folks mentioned. But I want to talk about inappropriate hospitalization of children and adults with developmental disabilities. And the DD Ombuds have put out 2 reports on this issue. A couple years ago, we put out a report about adults who were stuck in the hospital, and it was called Stuck in the Hospital. And then recently, we put out a report about youth who are stuck in hospitals, and it's called I Want to Go Home. And there's links to it. And this is, Diana was talking about folks who are children who are going out of state to get education, but also who are stuck in the hospitals. So the DD Ombuds have worked with youth who are stuck in hospitals, and we have some legislation that we are working to help get children out of hospitals, and also make it so children are not forced to go out of state. So one thing is we want DDA to collect data for all people with developmental disabilities who are taken to the hospital and get stuck there. Right now, they collect it from supported living providers, but they don't collect it if a person, say, is going from their family home to the hospital. And we know that this is something that happens, not because families want to do that, just because they're not getting the services they need. So to collect that data and also the ages. We also are looking to do plans, person-centered plans and service plans while folks are in the hospital that meet the state and federal requirements and behavioral needs. Expand the type of services and supports for people with developmental disabilities. We're working with the Children's Youth Behavioral Health Work Group on some recommendations on getting more supports for families, like to mention that paid caregivers for the parents. It's a good example. Making it so that there's more in-home services and consultations for people. Also, an increase in diversion beds would be something for youth with developmental disabilities. And then Dana, you can scroll down a little bit. We've also have had an experience with the Y services. So Y services work for youth with mental health needs to have supports, and youth with developmental disabilities sometimes get screened out or they're not referred to that program. So we want to look at how Y services can better support youth with developmental disabilities. So that are some of our recommendations that we think will help reduce the amount of youth who are stuck in hospitals and going out of state. And then those piled on with what a few other folks have suggested, we think that will help that issue. So the second one pager that we put is just around community supports, and some of these have already been mentioned, so I won't go over all of them. But caseload forecasting have been talked about. Make sure it's true caseload forecasting. Direct service professionals to get more funds, like Randy mentioned, for supported living, so we can keep supported living as a good option for our state. Also looking to modify RCW 7434, which is RCW that gives authority to APS, so make it so they can share information with law enforcement and state agencies, and also can clarify APS sharing information with the DD Ombuds. So the DD Ombuds often get calls around APS issues, questions and concerns. So this would make it so we can work with APS. Also, the no paid service caseload, which has been talked about, so I won't go too far into that. And then ensure that DDA contracted support providers have more training in developing individual and person-centered service plans. We are doing reviews on trainings, and then making changes to the vulnerable adult abuse registry to include a way for some people to have their names removed from the registry. People with disabilities and their families have worked on this issue in order to increase the pool of qualified caregivers. So we've heard stories of somebody being on that registry for an issue not related to developmental disabilities, and now they might have a child with a developmental disability that they can't be a care provider for. And the last one in this section is to increase the personal needs allowance for people living in medical institutions and residential settings. So this would increase the amount that folks can have for spending money so they can do more in the community, do fun things that we all get to do. So increase that, and that will be state legislation that gets proposed. I'm sorry, yeah, APS is Adult Protective Services. Sorry for using the acronym. And then the last issue that I'm going to talk about is reform to the Community Protection Program. But this will not be legislation that we think will be in the works this legislative session. But we are working with DDA to make changes to the Community Protection Program. And the community protection is the waiver that folks with developmental disabilities get put on if they do a risk assessment and they're deemed eligible. It requires 24-hour supervision. Some people feel like they lose their rights and they're not able to do the things in the community that they want. So we are working with DDA right now on maybe some changes to community protection. But our proposal is to have DDA provide resources to meet the needs of young people with developmental disabilities who are identified as possible community protection issues, so they can divert from the program. So we're seeing youth as young as 18 go to community protection waiver before they might get offered services that could help them. DDA should propose agency-sponsored legislation so individuals are not restricted from other DDA services or hours they choose not to be in community protection. Right now, if you're deemed eligible for community protection, you cannot decline that waiver and be on a different waiver. You would have to be on that waiver in order to get waiver services. And DDA should ensure each person has a clear path to graduation from community protection using a person-centered planning process. And then the last one is ensure DDA and their contracted providers meet all federal, state, and policy requirements to guarantee that people are not subjected to unwarranted restrictions of their civil and human rights. We want DDA to make sure they're following the state and federal laws when they do restrictions that people receive while they're on community protection.
Thank you, Noah, and thank you for covering all three of those for us. Was there any other questions? I know we're running over time because it's noon right now, which is when we should go to lunch, but we have Jamie Bond here from DDA, the Developmental Disabilities Administration, and she was going to talk to us for a few minutes about what the budget requests were from DDA. So do you want to kind of go over that, Jamie? And I will pull up what we have on it.
Yeah, that would be great. And I can put in the chat links to where folks can find all the details about each of the decision packages, as well as the reports that we've written to the legislature over the course of the last year or so, if that would be helpful.
That would be great. I put
Great.
together a side-by-side in the notebook, and I don't know if that would help with what you wanted to go over.
Sure, sounds great. So let me introduce myself really quick. My name is Jamie Bond, and I am the Chief of the Office of Program and Policy Development at DDA headquarters. I actually wrote several of these decision packages, and some of them I did not. So some of your questions I can probably answer, and some I will get answers to you if I don't know the answers. So do you want me to just go through this list, Diana, or just hit the highlights for what we have done? So I can talk a little bit about some of the decision packages that we put together. Some of ours are lumped a little bit together. Yours are more broken out, but essentially some of the things were already talked about today. So one of the proposals we've made is to create a specialty adult family home where we will do a pilot to serve about 400 people with living in adult family homes that will allow us to basically do a study and figure out if we put these enhanced services in place, is that helpful for people? Are we on the right track? So if that's successful, what we will do at that point is create a way for more than 400 people, whether they are on a waiver or not a waiver, we have to figure all that stuff out, but create a way for people to be served in adult family homes and get enhanced services if that's what they need. We also put forward a request for funding for out-of-home residential options for 134 DDA clients who live with their elderly parent caregiver. And essentially that would be 134 more slots on the core waiver was our specific request. That the money is earmarked, the slots are earmarked specifically for people who are being served right now in their homes by caregivers who are elderly. So we can meet those folks' needs. We also have a goal of reducing the number of children and adults that are in the hospitals. So we put forward a couple of different decisions and packages around that, which would essentially, the goal is to increase the capacity of our direct support providers, improve their staff retention through targeted training and recruitment supports, and just give more support to our children and residential service providers so that they can retain, train, hire quality folks who have better training and have more skills to serve the individuals that we need to get out of the hospitals. We've asked to expand behavior stabilization services. So we know that part of keeping people out of institutions and out of hospitals is preventing crisis for them, right? So this would be a way for us to have more mobile and bed-based mobile diversion services to prevent unnecessary hospitalizations and out-of-state services for clients that have, for folks who have particularly challenging behaviors. So that's coupled with a rate increase for providers to help, again, just provide more support to our providers so we can help folks not go into crisis. Let's see, we put forward a poverty reduction package that is really 4 decision packages, and in Diana's chart, you'll see them all broken out. But for us, it was a poverty reduction package that helps support our individuals with services and supports for estate recovery policies. So we want to be able to not have to seek funding back from estates in particular cases where it doesn't make sense. So typically when someone's receiving Medicaid, if they pass away and they have an estate, the state has to get some of those taxpayer dollars back through that estate. And in some cases, it costs us more money to actually seek that than it does that we get back. So we're asking to just reduce the burden of some of those estate recovery policies. We wanted to create a a non-citizens program specifically for DDA. The legislature already does have some funding for the Aging and Long-Term Support Administration to provide personal care and other services to folks who don't qualify for Medicaid because of their immigration status. And that program does serve some DDA clients, but they're case managed generally out of the Aging and Long-Term Support Administration. So we've asked to just have our own program for those folks so we can support them. We know their needs. We have specialized case managers. So we asked for that. Noah talked a minute ago about a request to increase the residential personal needs allowance for those individuals living in facilities. And we've also made that request. So we want clients to be able to have more of their own money to be able to pay for things that they need while they are at a facility, like televisions and entertainment and those kinds of things. So we also put forward a request for that. And then we also put forward a request to continue. We got one-time funding in the last session to increase our financial eligibility staff members. And we hired all those folks, and we are in the process of finalizing our report to go to the legislature to show that we have been very short-staffed in the financial eligibility section. And this extra funding that they gave us is wonderful and it's helping, and we want to continue that funding. Those financial eligibility staff are the team of individuals that review whether someone's Medicaid eligible, and being on Medicaid, as you all know, is very important because that's where we get our funding, right? Half of our funding at least comes from the federal government. In order to do that, people have to be Medicaid eligible. So this team is really important with making sure that we get people's Medicaid applications processed and decisions made in a timely manner. It also supports getting people out of hospitals and institutions, keeping them on waivers, all those things. So super important and has been under the radar for a number of years. Again, we just want to also, we put forward some requests to support our community providers. So we asked for community provider rates to be increased, right? There's been labor shortages, inflation, ongoing effects of the pandemic. So we have 4 decision packages where we're asking to increase provider rates for employment and community inclusion providers, translation services, community residential providers, and other community providers such as nurses and assisted living. So in hopes that we can increase our provider pool, again, get better services and supports to individuals and get them more timely. And then we have some other decision packages that we put forward around basically at the request of Hilma, right? So the Secretary of DSHS is very interested in increasing our technology footprint to make a better service experience for our population. So we put forward a couple of decision packages around technology that would ensure that we have a better service system for folks, right? We know that we're a little bit behind because most of our money that we always ask for, we ask for it to go for services. In this case, we're asking for it to go to infrastructure so that we can support people better, not having paper applications if people can apply online, those kinds of things. So we need to beef up our infrastructure in order to be able to do that. In a nutshell, that is the important stuff that we asked for. Questions, comments, concerns?
Thank you, Jamie. We're really glad you were able to fill in for Debbie and come and talk to us today. It's good to see you.
Good to see you too.
Diane, can I ask a question?
Sure, Tammy.
And I don't know if you would have the answer to this, but you were discussing about how the state can reclaim those dollars that were allocated to an individual. Say if they, when they pass away, the government has the right to go and collect those dollars. Well, how does the individual protect their family, loved ones, for not losing their home that they have. Is there any way to protect that?
That is some of what we've asked for, Tammy, is a way to get around some of those. The estate recovery policies and procedures are real complicated. So it's not in every case that the government is allowed to go back and get money, but in some cases it is. And we want to be able to reduce some of that burden for families. And so I can send out some information with some detail, all included in here, about what we specifically asked for to ease that burden and why. And then I can also send separately a link to some information just about estate recovery in general, if that would be helpful for you, Tammy.
Yeah, that's one of my kids here, because my husband and I have, we rent out our other home, but we're living we have 2 homes right now, but I don't want to see that being lost because I die. So, and I want me to leave something to my kids as well. So I just want to know how to protect our financial state, when I die.
Sounds great. I will put some information in the chat.
Thank you.
You're welcome.
Diana, can I ask a quick question? This is Carla Nibbler. Okay, Jamie, Jamie, what I was wondering if how to get a hold of someone at DDA if you have a lack of services for mental health for youth, especially those that are dangerous. We've been told by the local police department when we've called that the child has to be in a total outrage, go to the hospital, and the hospital emergency room has to do something. And I've called around and can't seem to find any assistance to move forward to put a child in a residential setting to evaluate, the meds, the behavior, etc. I mean, I don't know what to do.
Does the child have a DDA caseworker?
Yes.
So one, start there. If you're not getting if no one's getting answers there, everybody has a supervisor. So there's also that. And I have put together a resource that has the listing of each region has the listing of leaders. So beyond the supervisors, but the supervisors of the supervisors and above. And I put that all together. I can send it to Diana and she can get it out to folks.
Okay.
So if people get stuck, there's always someone to go above. And then they may help you with care coordination with the child's treatment team. If they need behavioral health treatment, that would be a Medicaid Apple Health problem, but we can help coordinate all of that. So I will get all that out.
Okay, thank you very much.
You're welcome.
Hey, Jamie, real quick, this is Michelle Odell. You had mentioned a pilot program serving 400 people with housing. And when do you foresee that starting?
As soon as the legislature funds it, I think typically things will start July 1. So if it's funded and the legislature approves it, generally our funding begins on July 1. So we would start that project then, and it's for 400 people for adult family home services.
Okay, thank you.
I was doing so good being slow too, just until the end.
Well, thank you, Jamie. We really appreciate you coming, and thank you for all that you do working with people. I know DDA has its hands tied budget-wise on a lot of things. So we're out here advocating along with you for those things to get funded by the legislature, and hopefully all the things you asked for will start on July 1st.
I agree. And I've been listening all day, taking notes about where I see some gaps and where I know that there's some education that needs to be provided. And so thank you for all of this. It's really helpful.
Thank you. Okay, well, we're a bit behind. We we're gonna have a lunch break at noon, and so we're gonna take it now. I don't want to do the full half hour and miss some of this last half of it. Can we do a 20-minute lunch break and everybody come back at about 12:35? Okay, I'll put that in the chat. And we will see you back here at 12:35.
Thank you, Diana.
You're welcome. Thank you.
Thank you, Diana. And also, my computer failed on me, so that's why I had to log back in.
Yeah, that happens once in a while.
Right. You want me to help you get your shoes on?
Are you done with your meeting?
No. I can help you for it now. There's a small little window Hey, Anthony.
Hey, Alex.
I like seeing your pictures of your trip.
Yeah. Oh, hey, Jessica.
I think she's muted.
Yeah, that's why I'm waiting.
Yeah.
I just want to let you know there's gonna have to be some modifications to that I'm gonna be making on my trip from the DDC for the meeting, but Katie will be taking over for me that day at doing the Zoom sent because there's interviews that have to be conducted by me and a few other council members
Or the rally, or what you
during the sale meeting.
oh, okay.
Yeah, so she will be substituting in my time. And once they make those changes, I'm gonna make her a flight off my own expense to get her there.
Okay,
So I just thought I'd let you know.
yeah.
And I'm gonna be showing her how to use the owl and everything. Oh, it looks like someone has an owl.
Kill myself, which I almost did.
Yeah, looks like somebody's using an owl.
I think it might be.
What did she say to
Ema.
that? Yeah.
I don't know. I think it's almost time to start, isn't it?
Because I've been playing Candy Crush.
Because didn't they say 12:35?
Yeah, that would be Diane though.
Yeah.
She's the captain.
Yep.
And a flipping good one too.
Yep.
Not taking my purse.
Hi, Elizabeth.
Well, welcome back, everybody. It's 12:35. And so I would like to get us started here. we're gonna be working on the budget part of the charts right now, starting with that. Let me pull my share screen up. And here is our first budget chart. And this year, I had somebody new at DDA who helped me with the information to get these charts put together for all of you to go by. And I wanted to introduce him if he's back to his here. JP, are you there? Maybe not back from lunch yet.
I am here.
Oh, good. Would you like to introduce yourself?
Absolutely. My name is John Paul Strzeski. I go by JP just because it's easier for most people. I am a data consultant with the Developmental Disabilities Administration. I work under Jamie Bond. And yes, this was my first year helping out with the caseload report and all the data for this advocacy notebook that comes from DDA.
Well, we greatly appreciate it. Thank you.
Absolutely.
Oh, I'm gonna Stacy, are you here?
I am, sorry, just trying to get off mute. Yes.
Okay, I have to step away for just a second. Can you kind of go over the budget chart a little bit?
I may be able to do that. Not as well as you did not tell me that I was going to do that.
Well, I didn't know. I have to step away for a sec.
Okay. So I'm going to be brief, and then maybe I'll let you, JP, kind of go through some of this information with us together. That would be a great change. So this graph shows the total amount of budget allocation for DDA, which is almost half and half state and federal funds. So we get 45% state funds and 55% federal funds in a match, totaling to about $4.7 billion in the DDA budget. I believe it is the second largest budget within DSHS. As you can see from the breakout there, oh, it's slipping down and I can't see the chart. That we have in-home services that are almost 40% of the total budget. We have community residential services, which are out-of-home services, generally speaking, at about 40%. So the rest of the 20%-ish of the budget, and I know budget people hate it when I round up and say ish, but that's how my brain thinks, are these other operational pieces and RHCs. So RHCs are our state institutions, and they comprise about 11% of the budget for 565 existing clients that are in those facilities. SOLAs are not included under residential, and it is about 4% of the total overall budget, 276 clients. And then there are field services, central office, and maintenance and operations, and other miscellaneous services under DDA. So that's always a question that legislators want to know, that people want to know. How does DDA generally spend its budget? And so I'm trying to see if there's anything else that I missed on there. In-home services, of course, at the top, you'll see what those are specifically for Community First Choice, individual and family services, and employment and day as a portion of those in-home services. And then, Diana, if you're moving that down, can you move that down a little bit?
Sure, I just did that. Can you see it?
Yeah. And so everybody needs to note that the statistics for how many people generally, based on census, we would expect to see for people with developmental disabilities is about 170,000. You can see that that is a change since the last census numbers came out. That does not mean that all of those people would be eligible. We have a very specific definition of developmental disability in our state. And it is focused more on intellectual disability and more significant needs. And so we know that unless and until our DD definition becomes a little more expansive, not all of those people would be expected to enter the system, but certainly more than half. So who's made it into the system is that second number, right around 50,000 people enrolled with DDA. Now, just because you're enrolled does not mean that you are receiving any services, as we've talked about many times. Right now, about 37,000 clients of the almost 450,000 are actually receiving at least one paid service from DDA. That does not mean that they're getting all their needs met. That does not mean that they're on the correct waiver. It means that they are currently receiving one paid service. And of the 50,000, that leaves us at about 12,469 people who are on a no paid services caseload. And so those are individuals who are eligible. They have made it into the DDA system, but they do not receive any services from DDA. And as most of you know, there's a no paid services caseload report being compiled now to figure out who are those individuals and what do they need. And with the addition of some case managers as of this last session, we're hopefully going to have more information about that. So Diane, I don't know if you're still on, but I think that
I'm back, Stacy. Thank you.
okay, great.
So let's see here. I'm gonna place there. Okay, so the next chart, this has a little bit more information about the state and federal, and somebody had asked a question about that earlier about what does GFS mean? Well, those are general fund state dollars, and all of the Medicaid services we get have a match to them from the federal government. And it's about 50%. That way the state has to come up with half of the money and the federal government pays the other half of the money for the services. So it's a good thing for our state to put money into services in Medicaid services because they get money from the federal government to boost up the budget in those services. And then there's a few places local comes into. And for each of these things that are on here, the SOLAs, the RHCs, the residential habilitation centers, and some of those others that you just saw up on the chart, the pie chart, there are FTEs, and those are full-time employees that this is how many employees it takes to make these programs work. And we've got about 4,700 state employees doing these programs. And this is the appropriation that we have, again, the federal money and the state dollars. And it tells you over the years since 2011, how much we spent in state dollars and how much we got in federal dollars to match it. This again is the pie chart, but this isn't the cost right here. This is the number of clients being served in each type of placement and what percentage of the people that is. So you've got the SOLAs, the state operated living alternatives, you have supported living. As you can see, the bulk of people live at home with their parents or a relative. And then there are smaller numbers. We do have people who are homeless, 142 people who are homeless who receive DDA services. We've got people in nursing facilities, the adult family homes, foster homes. And so the chart down below that, this shows the money that is spent. So now remember that other pie chart up above showed in-home, people living at home with their families was this whole piece of for the number of people. And then we have community residential, like supported living. We have the SOLAs, the RHCs, again, for
Diana, you actually went on mute, Diana. Something happened. We lost you just your last couple sentences.
Sorry, it does that automatically somehow. I don't know what's going on with it. Anyway, as you can see from these two pie charts, the residential habilitation centers is this little sliver right here. Not even 1% of the people, it's 0.9%. But then if you go look at this chart for the spending, the RHCs have 11% of the funding for less than 1% of the people. So it kind of puts it in perspective, and the people that live at home with their families comprises 72% here of the number of people, but they only get 36% of the budget.
Diana, I just wanted to point out, somebody's very good about checking the numbers. In the top graph, you have 270 people in Solon. This one you have 207. Just curious if that's a typo up at the top.
Oh, I bet it is a typo, one of them.
I'm sure you can correct that and we'll get reposted.
That's the thing with, I hope everybody will give me a little bit of grace. You know, I was out for surgery this summer for a couple of months, and that time period is normally when I would have been starting the notebook. So I got a late start to it, and there's a lot of new information in here. So I am bound to find mistakes, and if you find mistakes, please email them to me so that I can get them corrected, because it's not a big deal to correct them and then just repost them on this page.
Thank you, Diana. We still bow at your altar and are shocked you get all this done in the time that you do. So we appreciate it. And thanks for correcting that number. This is one of the reasons we vet this beforehand.
Yes. And so now we're going to go on to eligibility. So there's initial eligibility when someone comes to DDA applying for services. And then there are people who get services and they need to go through a review every year. So this details the eligibility reviews and the initial eligibility determinations that they go through. And out of those each year, it shows you from 2015 on to now, how many people were determined ineligible, which is the light color, and how many are determined eligible, which is the darker color. And the same with the reviews each year. And then when we look at this chart, you've got how many were determined eligible and determined ineligible, and here's the totals up above for each year. Okay, this one, they break it down by a lot of things for us so we can take a look at where this goes. This is eligibility by age group. So you can see whether they're adults or whether they're children or in between. And so we have that percentage of eligibility. And then the next one is by gender, male or female or unknown. Hopefully, you know, in years to come, they will break this out a little more, because we know that male and female is not the only gender anymore. So after gender, we get it by ethnicity, which is really important to know too. We're finding that a lot of areas, you know, we haven't really thought about other cultures and other races and how their needs may be different from someone who's Caucasian.
Hey, Diana, can you scroll up 2 things real quick?
To which one?
This one.
Okay. Did you have a question about it?
No, thank you. I got what I needed.
Okay. So ethnicity. And Hispanic is not considered an actual ethnicity. It's within the race. So they break it out a little bit different for that. And then by disability category, this question gets asked a lot as to what type of developmental disability are people being considered under. Okay, and so that's the last of the eligibility charts. Let me pull up the next one.
Diana, Noah had a good question in the chat. Do we know if the reason for being ineligible is tracked?
Well, my only thing, I mean, JP or Jamie, I'm not sure if any of you have a better response to it, but I would think it would have to do also with how many people are appealing it. That would be a question I would have within those two.
This is JP here. I don't know if Jamie is still on. I don't have that information for you, but I can ask to see if we can get that information. I would be surprised if we don't track why, but again, I'm not a subject matter expert. I can just pull the data, so I will get back to you.
Thank you, JP. Okay, and then we have, this is a chart that's often asked for, is where do people live? Do they live in adult family homes, supported living, hospital, a group home, a companion home, the SOLAs, the RHCs, parents' home. So this is broken down for the three regions. DDA has 3 separate regions to figure out who is where, and where you're going to get your services and information through.
Diana, we lost your screen share. Do you think you could help that?
Yes, hold on just a second. I'll try it again.
We need a production crew.
I know it's not working for some reason very well today. Okay, can you see it now?
Yes.
Okay. It also seems to have a delay when I do it today. Okay, so here is the chart telling where they live, and you have 3 regions, and it's broken out by adults and children, so that you can see how many in each of these settings are kids and how many are adults. And we have a good number across the section for children and adults, although it's almost twice in region 2, which is up in the northwest part of the state, including King County. So that's why we see that high numbers there. The next chart on residential defines it down even more, and it goes by county. Now, legislators often want to see, they know what counties they cover, and so they want to see the numbers for their area. And because there's so many areas up here, down at the bottom, we have a little chart here for the ABCDs across the top to see what kind of placement it is. And then you can tell your legislator, well, in Walla Walla, we have 10 people in this particular setting, adult family homes. A lot of this we try and do by county and region so that legislators get more of the view of, in my area of the state, which is what I represent, how many people do I represent that need this? Now, there's a lot more that need as opposed to just what we have, but we'll come to that too, that you can show legislators the need in their area. So again, where they live, obviously the biggest one is in their parents' home. They have their own home, supported living comes in here, and then relatives' home. They separated it out for this one. Usually relatives and parents are grouped together. But as you get down here, you see lower and lower numbers that don't even make it onto the scale. I do know that we have 322 clients who are over age 62 that live with their parents. And those are the parents that Jamie was talking about for those 400 slots, is to help with these senior parents who are still taking care of their kids when they're 80 and 90 years old. And that's what we come to in this next chart here, is the age of the caregivers. So we can look at the client's age and guess that up until 64 is this column that goes up. And it tells us how many people are being taken care of by their parents. And so, you know, if they're 44 years old, their parents are likely 64 or so, around there, and there's 138 of those. And then the next column is for 65 and older, taking care of their son or daughter. And we get down here, people who are 77, their parents who are taking care of them are likely around 97. And we don't have near as many, but you can see there's a lot of people in their 80s and 90s who are taking care of their adult son or daughter still at home. And that's what we worry about, is those adult family caregivers. If they pass away suddenly and their son or daughter is left in chaos, and they have to move, they have to deal with the grief of losing their parent. And there's just so much transition that would happen that would be really hard for that individual to go through. So we're really focused on the caregiving, the caregiver of the caregiving issue. Okay, so let me pull up the next section. And this is the no paid services caseload. And, you know, we've talked about, you know, making sure that legislators know the numbers.
We're not seeing anything, Diana.
I'm working on it, Alex. Just a second. So this is a map of our state. I'm going to make this a little bit smaller here so you can see. So we have a map here of Washington State, and all of the counties are broken down on here. And we'll zoom in a little bit closer. And so for Yakima, people who get a paid service, doesn't necessarily mean they're getting their needs met, but they get a paid service, is 1,379. But in Yakima County, there are 795 who get no paid service. And so each county, wherever you live on the east side or the west side of the state, you can look at this map and show your legislator, this is how many people are getting a paid service. And this is how many are sitting on that no paid services caseload. And this shows the amount of change. So each year we track who's on the paid and no paid caseloads and how much those total up to and the percentage of them that are being on a paid caseload. And then we check to see whether it's a decrease or an increase or no change from the last year. Okay, and that was the only one chart that we had under there. So give me just a second and I will pull up the next section. Okay, and we had talked earlier about the Katie Beckett waiver or the 1115 demonstration waiver. And so we have, there, you should be able to see that now. This shows the different states that have looked at getting a TEFRA waiver or Katie Beckett, or one calls it Katie Mulligan or TEFRA waiver. different states have different names for it. But you can see that a lot of them are waiving the income. This is to let those parents who would otherwise have to quit work and lose their health insurance that they have at work. And we want them to be able to buy into the Medicaid program so that their children can stay covered. So that's the TEFRA waiver. And if you have more questions, feel free on that one, call Stacy. She's doing a lot of work on that. This is our waivers, and a lot of, you got to remember, I think it's 28 new legislators this year in the House. They come in there not knowing much at all about developmental disabilities, and they have to learn about our issues as well as a big list of others that are going to come to them that they know nothing about. So one of the biggest misunderstandings is, what is a waiver? And it basically comes down to you qualify if you have the developmental disabilities and you they are severe enough to qualify you. You could go to one of our state's residential habilitation centers, the RHCs. They are an entitlement. If you live in our state and you qualify, you're supposed to be able to get placement at an RHC. But there's no entitlement to community services to live in the community. So when they created the waiver program, home and community-based services in the 80s, you had to waive your right to that RHC placement. And if you did that, then you could get some services in the community where you didn't have to move away and move into a RHC. You could stay in your home community, maybe living with parents or living on your own or living with other people with developmental disabilities, but you were in the community. So you waive your right to the institutional placement and say, okay, I want to get my services in the community. So it's important to explain, especially to new legislators, what that difference means. What is a waiver? So we track numbers back way back, and this is, chart shows from since 2015. We have the individual and family services waiver, basic plus, the core, the community protection program, and then children's intensive in-home behavior supports. And those are all outlined down below this chart. It talks about each one of those waivers and what it consists of, what services are available on it. And so these are the numbers over the years that we've had these waivers. Now you see this looks kind of weird from 397 on the IFS waiver in 2015. And suddenly in 2016, there's a huge jump. And that's because the legislature, we used to be a state-only program, and they made it into a waiver program so that we could get federal match for people. So they added a lot of people back then. Okay, and again, here's these numbers by county that the legislators want to see. They want to know how many people are on each waiver in their county. So you can show them, this chart show them how many people are in their county. And then we look at the costs and the caseloads for each of these waivers. And we see, that we've got community first choice, which is what we call personal care in our state now. And Medicaid personal care. That's what it originally was. And we have the IFS waiver, basic plus waiver, SIBS waiver, and the core waiver. And it gives you, as you can see, the cost per client each month and the average caseload each month. So this looks at the average monthly cost and the paid caseload from last year and this year. So over the years, this is the children and adults. It breaks it down by that so that you can see how many kids and how many adults were on each of these waivers. And we have the waiver capacity. What's the maximum capacity that there was a big change, and we're going to talk about this on another chart later, about getting the number of people on these off of the request list. And when the legislature gave us more money, then suddenly we were able to get more people on it, on each of these waivers. And again, here is the clients for 2022 and the average cost for each of them in these waivers. Margaret Lee asked about getting these in color. If you go to the website and open, that's what I'm doing, is opening each page on our website. And this is what they look like. You can print them in color. Okay, these are people who are on the no paid services caseload that had a waiver request that was denied because there wasn't capacity. Now, this is what the legislature asked for this courtesy caseload forecast off of, was the request list. And this is between last year and this year. Well, last year, there were 327 people on the request list for the individual and family services waiver. This year, there are 0. This is what the legislature got to see, was just the 0, because they were looking at 2022 client requests. Legislature gave DDA money to take people off of the request list and give them a waiver last year, and that's what happened. You see all these people that got a waiver service, and it's now 0, or as like plus 112 people, and 34 is what's left needing a waiver spot. So we're looking at trying to get more information farther back than just last year on the request list numbers, so we can show the ups and downs of these numbers. As the legislature gives them money, they get to take people off. But when the legislature doesn't provide money, we build those waiver request lists up. But again, not to show anywhere near what the real need is, because the real need sits on the no paid services caseload. So we really need to help people figure out if they're on the no paid services, they need to request a waiver. And there's some information in each of these pages on the summaries that's background information. Now, this is the community first choice. That's again what used to be called Medicaid personal care. And this is broken out by ages. That community first choice with someone can get a waiver slot, an individual and family service, and get CFC, the community first choice. And you can see there's a large number who do that. And then there are some that just get the service of community first choice for the personal care.
Diana?
Yes.
I have a quick question. I'm sorry.
No, you're fine.
Is there a, and I might have missed it, and I apologize if I do, but individuals that are on one waiver that are requesting a different level of waiver services, is there a place where that's being captured?
Not on our charts. That is something, JP, if you're still on, maybe you could look at that for us.
That's where I'm seeing a lot of families who are needing a different level of service and it's being denied. So there's a huge need there.
Yes, that's one of the reasons we keep saying that they may be getting a waiver, but it may not be meeting their needs. And a lot of those people don't know that they should request a different waiver. They just know their needs aren't being met, but they don't know they have to get on a request list in order to get moved to a different waiver. And with the openings that they have right now, they should be able to move to a different waiver.
I'm having families denied being moved to different waivers.
I would go up to a supervisor and talk with someone.
Thank you.
In our state, we have supplemental security, the state supplementary payments, sorry. This has been a program that's been around for a long time, where instead of getting the individual and family services waiver, you could instead get money from the state that doesn't meet the level that the IFS waiver would, but you get it in cash and you can spend it how you want. Whereas if you're on a waiver, your care provider has to meet the qualifications and get paid the rate that they're supposed to get paid. If you do it with state supplementary pay, you know, a family member who maybe isn't, or a neighbor who doesn't go through the process of getting contract, they could pay them through the state supplementary payment. Right now, the SSP is closed to new enrollees. And this is the monthly allotment level that they would get. Okay, we're going to stop sharing that section. And our next section is going to be on waiver utilization. This is a new section that we found this year. And we've talked about caseload forecasting for a number of years, how important that is to get caseload forecasting. One of the things we got this year was waiver utilization charts. Every, I think it's 18 months, DDA has to provide CMS with information about the waivers. Part of what that entails is each waiver, a list of all the different services that are available to a person who's on that waiver. And DDA has to project how many clients they're going to think need each of those services and how much money it will take to meet that need for that many clients. And basically, what has happened, because DDA doesn't have caseload forecasting, whereas just about every other state agency does, DDA has to do their own forecasting. They're having to put together these numbers and these amounts, and that's not their expertise. That's not what they should be doing. It's what the Caseload Forecast Council should do. So you'll see that there is some differences between what they projected and what they actually had to spend. And so in the middle column here, the numbers in red represent how much they went over because they projected under what they thought it was going to be, you know. And then the green is where they were underspent in it. And so we see this throughout each waiver, but I want to call your attention down here. Here's the IFS waiver, which respite is one of the big services that is used under that waiver. And they overspent by $2 million on how much they thought they were going to spend on respite. Again, remember, the DDA is not the expertise for forecasting, which is why we keep telling legislators, you need to have the Forecast Council doing this. So when we get Basic Plus waiver, And for respite, here they are, another almost $6 million overspent. And then we look at core waiver. Now, they have a lot of different services offered under the core waiver. And look how many red areas there are here. $200 million overspent just on one item, supported living. And the other support, the community supports for residential are all overspent too. 15 million, 4.5 million, 10 million. This is why the Forecast Council should be doing the forecasting of services for DDA. They are not the experts in figuring out how to do this. And we know that it's not coming out right when they are trying to do it. The Forecast Council needs to take on this issue and start providing services for DDA, just like they do every other agency. So I just really want to encourage you to use this section of charts, the waiver utilization, and let your legislators know this is why we need caseload forecasting. There's another 22 million in supported living. Okay, so any questions on that part? Because it's an important piece and it's new.
Very helpful. Thank you.
Good. I hope everybody shares it with their legislators.
I
I love how
concur
you
with
spelled out the
Darla.
differences.
I'm sorry, there was a couple people talking.
I love how the differences are spelled out there. That's really eye-opening.
Thank you. Okay, so our next section is going to be, that wasn't the right section. Hold on just a second. Yes, okay. Okay, so here we are with the no paid services caseload. Now we saw this chart a little bit earlier, from last year to this chart year. And obviously even with paid services or not, they were still denied last year, and some, lots of people on there, and then this year they all got on. So when we look at the new courtesy forecast, that was what we got last year in Senate Bill 5268. They said, okay, well, let's get a courtesy forecast for supported living and state operated living alternatives. And they had to go by the waivers because the supported living and adult family homes and such are embedded in different waivers. And so the Forecast Council took the numbers that DDA gave them on their request list and, came down. It was up here for a while, the number of people on those request lists, but now it's practically zero. So they expect that it's going to keep going that way because they didn't have the background of seeing what actually has been happening with those request lists. And so they're looking at that it's not going to make much of a change. And then they had to do the same thing for state operated living alternatives, but those had a different projection in that they had been steadily increasing as the legislature has given money for the SOLAs, but they haven't designated more openings. And I don't remember if Randy talked about it with supported living. Is somebody still on for supported living?
Scott's joined us, Diana. He might be able to if he's still listening.
Okay, so Scott, can you talk a little bit about what happens with supported living openings when they don't get used?
Well, that's a great question for Jamie, since we've been going back and forth on that question. The quote unquote slots are there. They're still funded. There are referrals out. We've heard there's over 400 referrals out for services. It's just that they're not filled at this point. But the money's still there, the slots are still there, they don't go away.
Oh, that's good to know, because that was the last I'd heard, was that they were taking them away each year.
No, they take away the underspend. If we don't use all the money, it goes away, but the slots are still there according to the latest conversation we had.
Okay, good to know.
Sure.
So the solas anyway are going to continue to go up as far as what they saw in the forecast, but we need to help them understand that the forecast for the waivers is going to go back up, because we're going to be hitting hard and heavy with all the people sitting on no paid services. Now, remember too, they have not had a case manager to talk to since 2011. We got them new case managers, but it's going to take a while to get them hired and get them trained. But as people start having a case manager to talk to who has been trained to say, yes, we can put you on a waiver request list, we need to do that. Those requests are going to go back up again. And that's what we need to show legislators. This zeroed out line is not the reality of people who are going to be requesting a waiver.
And Diane, I just wanted to, there's a couple questions in the chat that are similar. So let's just say that a DDA client is authorized for, 57 hours a month for a particular service, and they don't use those hours. Are those unused hours still accounted for in the service matrix that you showed that have the hours of, different services that are underutilized, or is that a different set of data?
No, I think that would be included in that.
Yeah. So the numbers.
It goes by two things, by the number of people served, because they project that, and then there's an actual, and then the amount of money that they thought they were going to spend, either over or under, is what that middle category showed. So I believe that would be accounted for in there.
So that chart not only shows people who aren't asking for a particular service, but also services that are approved, but just don't get utilized because they're, for example, probably aren't any service providers.
That's a big piece of the question is, when they don't have providers. When I first asked for waiver utilization, that was what I was looking for, was how many people had the service but couldn't use it, and if that was broken down by like not having a provider. And what I got was very different, but I was floored, because it'll be so useful in our arguments about why caseload forecasting is so necessary.
Thanks.
So remember, all of these pages are on the legislative notebook page on our website. And so you can go and view those pages and print them out, whatever you need to do with them. We encourage you to use those. And if you have any questions, we have to do a brief overview here today, but if you have questions about any of this, you can always email me, and if I'm not the person, I'll get you to the person. Whoops.
Hey, Diana,
Yes.
I had a quick question. Do you know when the Happy Faces will be dropping?
Not till after session starts. We have
Okay.
to wait until legislative session, and then that's when they will start, first of all, dropping bills that we can put smiley faces on. And
Okay.
we already have one for the governor, or no, not the governor's budget, DDA's, their chart that we started with Jamie about the different things they've asked for. The governor will come out with his budget in the middle of this month, and then we will make a smiley face chart for his budget. Okay, this chart here is from OSPI, the Office of Superintendent of Public Instruction. And it shows each, this is the students who are receiving special education services in what we call an IEP. the individualized education plan. So this shows all the numbers of kids and their ages and how many kids are under each diagnostic criteria that they're receiving the special education services. Then I'm going to move on. This is another big point of what we're going to be sharing with legislators. These are the students who are being placed out of state. Now, this doesn't count all of the kids that are being shipped off to a different school district, which happens. Somebody in Eastern Washington might get their child have to go to a school in Western Washington. You know, I don't have the specifics on those right now. What was more concerning is the children who are being shipped out of state to residential placements in another state. And all of the school districts, you know, we've got them listed here, who the school district was that sent them, and what the placement place was, where it's located, and how much was approved for their placement cost. Now, there's 2 pages of this. Imagine how families are affected by this. 3 pages, sorry, but the families that are affected by their kids being taken out of their family home and shipped off to another state. And the cost, you know, some of these, it's amazing, $20,000 for a year was all that was spent. And yet others, I think there was a 682,000. Why are we paying 20,000 for one kid and almost 700,000 for another? What's the difference in the services they're receiving? And I can't imagine we can't take that $682,000 and pay for staff and a program that could help them and keep them here in their own home. You know, they should not have to leave the state to get an education. And other states don't. Other states have programs, obviously, and not ours are residential facilities because the kids have to go to another state to have a place to live. But there are programs within our state. That's why some school districts will ship the child from their district to another district who has an appropriate program. We should have those appropriate programs in every school district in our state. And especially when we look at how much they're paying to send our kids out of state, you know, they can pay for a program and the staffing. Staffing again becomes an issue. Workforce is a huge issue on all realms, but education is one of the places that we just aren't getting people who want to be special education teachers or regular education teachers. We have a huge deficit in that workforce. So again, you can share by your local school district, kids that are being sent out of state.
Hey,
Linda, I see you got your hand up.
Yes.
Linda?
Yeah, can you hear me?
Yep.
So, yeah, just on that school issue, it's in my experience, it's more complex. It's also reflects the lack of capacity for residential placements for kids with more challenging behaviors within Washington state, or even just the lack of available support for those people to stay in their homes. So it's like this coming together, this perfect storm, and it's seen by many families as a solution to do, you know, a double problem.
Right.
I just want to throw that in. Thank you.
Thank you. Justin, or wait, Michelle, it looks like you're in.
Thanks, Diana. So maybe Stacy can help with this too, since you worked at OSPI. Isn't there an algorithm, like a pretty intense algorithm where OSPI, the school district, the family, they all have to go through lots of assessment to get to this point of sending their child out of state because we can't handle it? Or Washington State can't handle it? I would think that there would have to be pretty rigorous assessments, not just, hey, well, we can send them out of state. This is getting easier and easier by districts. You know what I mean? I would hope.
Yeah, I'm happy to answer that question, Michelle. I didn't work for OSPI, just, I worked for OEO.
OEO, I'm sorry, yeah.
Just gives you different slants on the source of information, but yes, school teams through the IEP process go through any number of conversations about whether or not the local public school can meet a student's needs. And sometimes the IEP team together with the parent comes to the conclusion that the student's needs can only be met somewhere outside of the district. And there are a lot of conversations about where that is and what that will cost. And as you can imagine, oftentimes cost leads the conversation, not whether or not a particular layer of expertise can be added by a student going to a program outside of their local public school is the solution. So sorry about that. I'm going to talk a little slower. So I think that it is a complicated process, and it takes a long time for a student to get to a non-public agency or NPA. And we just have to ensure, a couple of people have said, are we advocating for residential schools in Washington State? And that is not what we're advocating for. We're asking that public schools be really good partners with the experts that are within the community that have expertise and specialty in the area of a child's disability and their learning, and that they develop more tools to be able to educate students with developmental disabilities.
Yes, thanks, Stacy. Justin. Justin, do you have your hand up?
Yes, sorry. I was thinking about it, and yes, I've had that experience with where my IEP team decided to, they waited a while and decided to put me in the school for the deaf in Seattle, because there's no other schools here in Seattle, not Seattle, here in Kitsap County area for people with the deaf. And I think maybe that was a little too expensive and a little too much, and then they had to drag me back here, which I don't mind. So is that like an example of what you're talking about?
Of going from one district to another, yes.
And that doesn't sound like something that should have happened.
No, and it sounds like you were on a long bus ride both ways too.
Oh, you got no idea. It was depressing.
Yeah, kids shouldn't have to go through that. They should be able to get their needs met in their school district where they live.
I agree.
Okay, so let's move on because we're running out of time here. Employment. We've got some statistics from DDA by county again, so that you can show your legislators how many are getting individual employment services through that. Some are in group supported, but the majority are in individual employment. And then community inclusion. And we expect to see those numbers grow a lot because of the bill that passed last year that allows for both employment and the community inclusion services. So you can use this chart to show your local legislators the county numbers. This chart goes a little bit deeper into the acuity level that a person has and how many are in minimum wage or self-employed, how many are looking for a job so they don't have a job right now, and how many got sub-minimum wage. Now, in our state, they don't do that anymore, but these are the recorded numbers from the last time. And then you can look farther into how many people have high acuity needs for employment supports, or medium acuity or low acuity and under those different job titles again. And then it's always good to know what are the average number of hours people get to work and how much do they make. So for individual employment, which remember most people are in, they get support for about 2 hours a week. They get to work for 10 hours a week and they make about $156 a week. Now that's not very much. Most of us work a 40-hour job. Now, there are a lot of people with disabilities that's not feasible for them. But I know a lot of people with disabilities want to work more hours. They're just hard to find jobs that they can get hours with. And then this goes into back into 2015 up through 2021 on the client hours and number of people supported. And this goes back to 2014 and breaks it out how many were looking for a job, how many were getting paid sub-minimum wage, and you can see that going down and down and down as we got rid of that in our state. And then minimum wage or self-employed is the biggest amount. And here's that on a graph to show how much people are earning is going up. Now we got a big boost in the minimum wage, so that helped. But you can see back when we got hit with the COVID thing that our numbers went down. So that's the employment section. Okay, so we got, I mentioned about the residential stuff, and we had, this was a last minute one. So if you looked at the thing over the weekend or when I sent it out on Friday, I think it was, this page wasn't in there yet. But this talks more about housing for the BIPOC community. And ODMF actually did a survey and surveyed, the people that are part of their organization about a lot of different things with the BIPOC community. But are their housing needs being met, or do they need a different housing option? Only 16% said, yeah, we got housing that meets all our needs. But 42% said somewhat it doesn't meet their future needs or not all their current needs. And then 24% with not at all, our housing doesn't meet our needs. And over half of the people that responded make less than $35,000 a year. So they have a list of all these different things that were important to them to be part of, the housing piece. So you can look at these later, and I know Peter had planned to be here today, but didn't make it. So you can contact him or Moses at Open Doors if you have more questions. Okay, so we're going to wrap up here pretty quick because I want to make sure we go through and just look at what's under the reports. Sorry, give me a second to pull the next one up. I want to cover the RHCs. Come on, open. Because there's going to be a lot of talk about them this legislative session because of Rainier and all the issues that it has. Okay, do you see that one? Yeah, it's coming up. So this is the historical use since 1966. There was over 4,000 people in the RHCs then. And you can see how that number has declined every year. This page tells you a little bit more about the history of each one of the RHCs, and then ends with the Center for Medicare and Medicaid, CMS. When these RHCs are put together, they were places where families could send their child, their son or daughter, and get them educated. Back then, there were no public education spots for kids with disabilities. And they were supposed to go there and learn skills that when they turned 18, they could go back home to their home community and be able to participate in and do something because they'd learned those skills. Like in Rainier School, the boys were taught to milk cows and do farming things, and girls were taught sewing and cooking and things like that, so that they had some basic skills. But over the years, it became someplace that doctors told families, just put your child there and go on with your life. And that happened with so many kids as they grew up. They were told they didn't even have family alive. So CMS said, wait a minute, stop. Well, you guys have been doing this wrong now for a while. The places where people live in the RHC are called intermediate care facilities. They're called intermediate for a reason. It's not a permanent placement. It's not supposed to be. But in our state, it turned out to be that. And so CMS has said, no, stop here, relook at this. These people need to be getting skills. They got to be learning. And then they're supposed to go back home to their community. And that has put a big pressure on the RHCs. And then Rainier, of course, has the lawsuit against them for abuse and neglect situations that have been happening over the years. So we expect to hear more about the RHCs this year. This is a map of our state, and we have 4 state institutions, one over here in the Spokane area, one in Yakima, and Pierce County and King County. And we have the numbers here, the census for each one of those for 2018 forward. So this is what we have left in Rainier, 125 people. And there's a breakdown of the other 3 RHCs too. Now we have both the intermediate care facility and then a state operated nursing facility. That's a little different than the ICF because that is for people who have significant medical needs, nursing needs. And oftentimes those are elderly people. So this is a chart that really helps legislators to see what they're looking at. This is the number of people living in the RHCs. And as you can see, it continues to decline. But the average cost per day goes up and up and up. So when legislators see this, that big gap there between the number of people and the cost, whereas it used to be just the opposite, it makes it stop and think about where should that money be going. And we have this many employees at the RHCs. And that's been harder and harder to find too. The RHCs can't find staff. And like in Rainier, that's way out in Buckley. Nurses in Tacoma don't want to drive clear to Buckley every day to work. And so Rainier has a real hard time getting staff to work there. And then the guardianship at RHCs for the clients. Most clients have a guardian, but there are a number of clients who do not have a guardian living in RHC. And then RHCs are used for respite, for planned respite, and then sometimes emergency needs, they have to have someone go there. And so the planned and the emergent needs are shown here in these charts. And I hope that you all will explore this page, more on your own time later after this. The hospitalizations, I want to go back and just look over that one real quick. Let me share that. Sorry, this is taking so long. My computer's working slowly today. Okay, so this is the client count of people that are hospitalized with no need. And it's broken down month by month. Of course, we don't have the last 2 months yet for this year, but you can see all the hospitalizations that have happened for people with out of medical need to be there. And then this is an average of how long they're staying, 108 days, or 108 clients, I'm sorry, have been staying about 84 days in a hospital. And again, we know the answer to this is not easy. We've got to get housing, we've got to get workforce and get those services matched up and provided to a person in one place. So it's not an easy fix, but our state has to look at doing this better. People shouldn't have to live in a hospital. When you're in a hospital room, typically there's a lot of them that have no windows. You're not leaving this 10 by 10 square foot of space. Can you imagine living a long time, living a year in one room and not being able to leave it? That's not how I want to live my life. Okay, so let's go
I was
to.
just gonna point out on that slide, right now, it would appear that DDA has a number of waiver slots available. Diana's slide showed that some of the reasons people are not leaving the hospital included no provider available. The provider needs to have staff and housing available for that individual. The client's not behaviorally stable, which is not a medical condition. It requires other kinds of supports, and there is no availability in the behavioral health system to support that. In addition, we know that a lot of our folks don't necessarily need to be in the behavioral health system. They need behavioral supports, which is something that we should be providing through DDA. So, in addition to asking for waivers, we're going to have to spend a lot of time talking about this disconnect that's come up through the data quite clearly between eligibility, the assignment of a waiver, and then the actual ability to get services that someone needs when they need it. And this is probably the greatest challenge that we're going to face in terms of conversation with DDA and legislators, because there are a lot of different ways to look at this and get at the issue. You would think that it would be easy, but it is a complex problem. So thanks, Diana, for highlighting that on this slide. And then before we close, Diana, I just want to make sure everybody knows, a lot of you have put questions in the chat, and if you want to email Diana and me, questions that have come to your mind that you would like us to pose to DDA, we're happy to do a follow-up with that and try to see if we can get some additional data and or put it on our list of things with DDA to say, we think this data is critical to answering those questions that I just posed.
Yes, thank you. We really we'll save the chat, so we'll go back through that and know the questions that were asked that we didn't get time to go through today. So on the webpage, there's a section about the budget. I'm not going to go through it all, but I wanted to highlight that we have a budget chart in here. This is what DDA requested, how much they were requesting for it, and how many FTEs they asked for. So you can go through there, and the rest of it is more technical. I just provided each one of their requests as it was put into the budget request that DDA sent to the governor through DSHS. So the middle of this month, we'll have the governor's budget, and then we'll start looking at where we're moving to the legislature. And remember, the budget hearings are usually the first couple days of session, so be ready if you want to have an input on what's in the governor's budget. Be ready to do your testifying at those, or you can submit written testimony as well. So the biggest part of this last section is reports, and we're not going to go through the reports today because we don't have that kind of time. But I wanted to highlight for you what you can be looking for. Let me share my screen again here. Okay, so these are all reports that the legislature asked for. They said, we need more information on this. There's their annual quality assurance report that they need to put out. We have this is the newer housing report, that this one, the December 22 is the one that just came out. We have the nursing care pre-design about nursing care in the community. No paid services, community respite and stabilization, using the professionals that are in the RHCs for people in the community. SOLAs, more housing, employment and date rate study. That's a big part of what employment is using for their ask, is based on that study. Best practices for co-occurring conditions, guardianship laws, apprenticeships for healthcare people, a peer mentor program, the TEFRA, the waiver that we talked about, foster youth eligibility report. Then all of those reports that Disability Rights Washington did, the no excuses, no more excuses, no excuse for exclusion, and on. And then the lawsuit is listed here. You can read the lawsuit for yourself too. And then I want to go home, no way out. Those were those DD ombuds.
Diana, could you slow down just a tiny bit for the interpreters?
Yes, and we have the case for inclusion, which is an annual report that's put out for the nation. You know, it covers all states. Direct care workers in the United States. National strategy to support family caregivers. The Ombuds annual report. The Office of Education Ombuds annual report. The Washington State Rehabilitation Council, their annual report, and the 43rd annual report to Congress about people with disabilities in education. So there's a whole lot of reports out this year that are specific just to the issues we've been talking about. And I want to encourage you in your own time to go look at the advocacy days. They're all scheduled out, so you'll know which advocacy days you want to attend. I encourage you to attend them all. And those are all on the advocacy day page of our website. And then the IDD 101, educate your legislature. All of these pages listed underneath there are pages that are included in this, so that you can give a basic understanding of all the different issues within DDA that new legislators should know about. I'm in the process of updating the legislators and state officials one. As soon as we get all of the committee assignments, those will be put into this, and then you'll be able to know those. And each of our organizations that is involved in our issues provide a one or two pages on their legislative priorities. And so those are included here. If you're interested in, you know, what is employment going to be working on? You can look at their legislative priority there. And then below that is all the fact sheets that DDA has for programs and services. And it's broken out in topics. And then it has a list of all of the different pages that are in there. And then there are a few resources down here that we list. Some of those are in English and Spanish. And each of our advocacy days will be in English and Spanish interpretation when people want to go to those. After we finish here, later on, you'll receive an email with a link to the feedback form. And I really hope that you will all take the time to fill out that feedback form. It's very easy. It's online. You just put boxes about what you thought about the information that you got today. So I hope you will get that for us so that we can learn from it, do things better. I know there's never enough time to cover everything and let everybody talk about all the things they'd like to. I wish we could spend a couple days doing this. But feel free to ask any questions. You can contact me. I'll put my email in the chat here just so everybody has it. And if you have questions, you can contact me. You can contact Stacy, Brandy at the DDC. So I just really encourage you to be informed when this legislative session starts, because it's going to be very important. And our voices are getting heard. We have a lot of legislators who haven't understood some of the things we needed that are now understanding it. And we've got some committees with some really sharp legislators on it that will really be working to help us. So make sure that your voice is heard. If you don't know how, just email me and it will help you figure that out. So Stacy or Brandy, did you want to throw in anything before we leave?
I think I've talked enough. Brandy, would you like a few minutes to comment on anything or wrap up any details that you think we want to be sure to say to folks? I can't say enough that, you know, this is a miraculous set of data that Diana puts together in collaboration with DDA. And if you see any mistakes or have questions about it, please let us know. If you have questions that came up after today that you think are data points we could explore with DDA, please let us know. Please send that. And again, we're fortunate to partner with the DDC. And in order to do that, we need to give them feedback on how valuable this information is. So please take a minute to fill out the survey form. Brandy, I'll turn it over to you for the goodbyes.
I was just going to throw out, I think you folks heard a couple people say we hope to see you in Olympia this year. And while advocacy days will be virtual this year, we hope that you still are planning to meet with your elected officials. And the council meeting, the Developmental Disability Council meeting, will be in Olympia in January. And we're trying to get our council members excited to go meet their elected officials. We hope you'll be doing the same, and we hope to see you in Olympia. Thanks,
Oh, Brandy, that's a good reminder. We are doing advocacy days virtually. That everybody gets to participate that way. But for those who are more boots on the ground and are closer to Olympia and want to participate, if it is open to the public to do so, we will be meeting up with people after the Advocacy Day program in Olympia at the Capitol and help you find legislators to talk to or hearings to attend or things to do. So we're kind of putting that on hold yet until we get closer to January and see what they're going to be doing. But thanks for that reminder. So thank you everyone for attending, and we'll see you soon.
Thanks, everyone. Take care.
Bye, everybody.
Thank you, everyone. Excellent work, Diana.
Thanks, Darla.
You're terrific, Margaret Lee.
Thank you, Margaret Lee.
Thank you, Diana. This was amazing. Thank you, thank you, thank you.
Thanks.
Round of applause on my virtual screen.